na hindi ka pwede mag-time out eh. Ginawa itong batas, assuming you want to take a conservative interpretation of that. When this law was fixed, wala pa yung nasa air yung virus. No? Hindi ka pwedeng sumawag ngayon. Sandali lang, time out muna. Mag-emergency special session kami. Gagawin namin yan. In the meantime, many have already been afflicted by it. For an example, here is a question from the chat box from Karen May Paurillo, President, All UP Workers Union, Manila, to everyone. Directly catering to or in contact with. We are not being tested. Therefore, we do not know who among our ranks is infected. Aside from patients and watchers, more than 3,000 health workers of PGH has no SRA from December 20, 2020 until June 30, 2021. We are a COVID referral facility. Yan yung makikita yung problema eh. It's slapping us in front of our faces. So we really have to make a decision. The decisions will have to be made. It's hard, but we just have to do it. So I think we can move on. Yes.
Mr. Chair.
Yes, Marites, go ahead.
Mr. Chair, Risa Ontiveros, sir.
Oh, Risa, go ahead.
Thank you, Mr. Chair. Just to follow on your the chair's discussion with COA Chair Aguinaldo, tingin ko po talaga we should err on the side of a more liberal interpretation kesa restrictive dahil yun na nga po yung naging problema in the last 1.5 years. Kahit na otherwise mandated by law, nagkaroon ng mga exclusion. Maraming private hospital employees hindi na benepisyohan ng kahit ng bayanihan 2 at pati yung mga kababayan natin sa mga public hospitals ay nagsasabing may mga gaps pa rin sa kanilang pagbebenepisyo. And as the chair was discussing with COA Chair Aguinaldo, our health experts led by DOH have taught us that kung saan closed, air-conditioned, high viral load environment, dun pinaka-vulnerable. And those descriptions fit hospitals more than any other setting. So talagang dapat lahat ng hospital employees as much as possible ay mabebenepisyohan doon, Mr. Chair. And Mr. Chair, I've been seeing Kawili Pulya of the Alliance of Filipino Workers. Mga union po yan, Mr. Chair, na mga private hospitals who was wanting to raise a point to the chair if the chair could acknowledge him. Salamat po, Mr. Chair.
Let's quit while we're ahead. I think we have a very clear opinion already by the COA. Panalo na tayo doon sa issue na liberal interpretation. Ang tatanungin ko ngayon, ito sa DBM naman. Paano ngayon, natapos na yan, paano ngayon yung hindi nabayaran? Yung hindi nagastos sa pera, sinodi sa inyo. Paano ngayon yan? Paano natin naayusin yung problema? Anybody from DBM?
Sir.
Please sound off.
Yes, sir. We need a law, sir, kasi reverted na yan under Bayanihan 2. We released...
This is Secretary Kanda, right? Acting Secretary Kanda?
Officer in charge lang, sir.
Ayaw mo ba maging secretary ka? Secretary ka na para magawa na yan. Okay, go ahead.
Sir, we released 9.02 for SRA in I think June of this year, and they reverted an amount. Unfortunately, without a law, we cannot provide any amount for the SRA at the moment. There are
But you have to find a solution, ma'am. Di ba pwedeng special SARO?
No, wala na yan. Mr. Chairman.
Yes, Senator General.
Yes, yes, the DBM is correct. Their authority expired, and therefore they cannot release. My suggestion is that we include this in the forthcoming budget of 2022. Total, nandyan na yan eh. Hindi na, we can just make an amendment to the 2022 General Appropriations Act. We're just talking about 5 months. As soon as we pass the budget, it should be available because the DBM is correct. Their authority to release expired with the expiration of the law.
I agree with you. I'm just trying to makakalusot, ilulusot ko yun kung may extra sa ano. But unfortunately, pag nag-budget tayo, Senator Gilon, matatagalan na naman yan. I-release siya sa 2022. Huling-huli na. Baka may mga namatay ng mga nurses dyan. Yun ang problema ko. Katulad nga ng pinakita kanina ni Secretary ni Senator Pangilinan, andyan siya, si Maria Teresa Cruz, yung anak ni Joy Cruz. Tumanggap siya, namatay na yung nanay niya. Wala siya natanggap at nung dumating, ang binatanggap niya 600 pesos lang ata, samantalang ang dapat tanggapin ay 30,000. Di ba, Senator Pangilinan? Andyan yung litrato niya. May lalabas ko. Ayan yan. Oh.
7,000 ang natanggap. But we want to also know, meron pa ba siyang natanggap na iba? But yung unang report of the expected 30,000, the 7,000 lang ang natanggap.
Mr. Chairman.
So there really is a problem. And I'm not one, and I'm sure all of you are not one to say, okay, we will let this simper. No, we will have to hold the bull by the horns and make decisions, because in behalf of our nurses and behalf of our health system, we cannot allow it to get broken.
Mr. Chairman.
Right?
Mr. Chairman.
Yes, Joel, Senator Villanueva, you have a question?
Mr. Chair, it's Senator.
I'm sorry, Senator Mix is first. I'm sorry. Hindi ko na kilala, puti na ang buke. Go ahead, Senator Mix.
Parang mas matanda na ako sa iyo, Chairman.
I will give way to the
Thank you.
older.
Just quickly, Mr. Chairman, last week when we locked down for ECQ and NCR, we had released almost 15 to 20 billion pesos worth of ayuda.
What are you doing? Okay.
There is no more Bayanihan 2 in effect. So may I ask the DBM Acting Secretary, Secretary Kanda, Ma'am, paano nila na-release yung ayuda na bilyon-bilyon sa taong bayan? Bakit hindi natin ma-release yung mga nurses na pinangako na natin yan sa Bayanihan 1 and 2? Secretary, how could we have released that fund to the IU to give to our people, which I'm happy they received it, I'm happy we released it. And these are not obligated. There was no law to obligate this fund. So why can't we do the same for the nurses, Secretary?
Sir, yung sa mga yung may funding source po kasi yung sa ayuda. There are two specific sources which we use to fund the ayuda for Metro Manila, NCR, and then for Laguna and Bataan. We use specifically the savings coming from 2020 appropriations from agencies.
Correct,
And second-
Secretary. So what you're saying is you were able to identify funds, utilize that funds for an item which is not in any law at the moment. Kasi ginawa lang, tapos na yung Bayanihan 2. So pwedeng gawin, ma'am. Pwedeng hanapan ng fund source yan. At pwede
Yes.
pong ibigayan, Secretary. Just like what you did last week.
Yun hong sa yung ginamit po dyan is covered by Administrative Order 41 12.1 billion ho yun, naubos na ho yun dahil nga pinamigay para sa ayuda. Yung sa SRA naman po na yan, pwede pong ang gamitin dyan is yung savings na identified under DOH specifically. Kasi meron pa naman po sila sa 2020, kung yun po available pa at walang paggagamitan, pwede rin ho yun for the SRA just in case.
O pwede pala, Secretary. What you're saying is we don't need to pass a law because if we pass a law, it will take at least a couple of weeks before signing of the President. Baka abutin ng October yan. We don't need to wait for the 2022 budget. Pwede nyo pong gawin, Secretary.
No, sir. Ang gagawa po niyaan at mag-identify ng funding source specifically will be DOH. Meron kami record ng kanilang appropriation, tsaka yung mga balances. But then again, we are not sure whether this has been earmarked already by DOH for its priority projects and programs.
At least we'd like to put that on record, Chairman. Meron pong paraan. Kung gusto mo talaga ng paraan, may paraan. Mr. Chairman, because they gave ayuda last week without having with the Bayanihan 2 already expired. So, yun po, Mr. Chair, for the record, hanapan natin ng paraan dito sa savings ng DOH.
Kaya kung may savings ang DOH mix, let's Senator Subiri, Let's ask Secretary Duque, may
Correct.
savings ba
Thank
kayo?
you, Chairman.
Mr. Chairman,
Ang
just a
dami
short
pinadaling na pera
intervention.
sa
if I may.
DBM. Di ba savings yun?
Mr. Chairman.
Yes, Senator Angara, the Committee on Finance.
Yeah. Thank you, Mr. Chairman. I just like to contribute to a very important point raised by the chairman and our majority leader regarding the Bayanihan 2 funds, because that's the statutory basis or legal basis for dun sa pagbigay ng mga benepisyo sa ating mga health workers. And the Bayanihan 2 law, although the majority of the provisions have lapsed as of June 30, but the provision on health benefits to our health workers specifically states that it shall subsist or pwede pa rin ibigay yon so long as yung national emergency as declared by the president is in force, Mr. President. So I think that's an important point, that as long as that national emergency is there and it has not been withdrawn by the president, then there is legal basis under Bayanihan 2 to give those benefits, Mr. President. Yun lang nga, the problem identified by our colleagues as to funding source subsists. And yung savings, pwede yun i-realign po from other sources. Just wanted to add to the discussion, Mr. Chairman. Thank you for allowing it.
I quite agree with the distinguished gentleman from Aurora. And certainly, kung may savings ka, this is a state of emergency. People are dying. Parang in articulum mortis na yung mga tao natin. Kailangan talaga, bigyan na natin talaga ng tulong kagad dyan. Dahil unang-una, sabi ko nga, kung suddenly we wake up, wala na tayong nurse, ayaw na pumasok. Dahil lalo na ngayon, alam nyo, magpapaalam ako 100 beses sa asawa ko bago lumabas dahil natatakot dito sa lakas nitong kwan. Dahil my wife is, as you know, may autoimmune syndrome yan. So talagang delikado. Dahil lalo naman na yung nurse, kawawa naman. Like when there was a fire in PGH, I went there. Nasusunog yung PGH, galit na galit sa akin ang staff ko, ba't ka pumapasok dyan? Affected na rin ako dun dapat, di ba? Affected na rin yung mga tao ko sa Red Cross na nagpapatay ng sunog, naglilinis ng hospital. Yun ang sinasabi ko. Hindi tayo pwede mag-quibble dyan because lives are at stake. And maybe Senator Angara, we can, with the help of everybody here, as a tayo, we can find a way to see our way clear na magamit yung pera kagad at ma-address na yung problema yan. Not a maybe, but let's find a way.
I fully agree with you,
May
Mr.
I?
Chair. I
So
fully
my
agree.
question still remains with
Chairman.
Secretary Duque. Do you have savings na mapagkukunan natin? Secretary Duque?
Yes, can you hear me, Chairman? Can you hear me?
Loud and
Can you hear
clear. Loud and
Can you hear
clear.
me? Okay, thank you, sir. Yes, certainly, we will look into freeing up some of the funds, no? Since today, there are still ongoing procurement, no? So ayusin namin. I cannot give you the clear answer right now because we have to look into it. Kung magkano yung pwede natin i-realign.
Okay, we will have another hearing anyway. Can you please proceed post-haste into finding your savings that if we can use that?
Yes, today I'm going to order an immediate determination of that amount, Your Honor.
Wonderful. I'm willing to call another hearing this afternoon if you can do it by this morning or this afternoon or even at night if you like. Para lang matapos itong problema ito because you cannot put this to sleep and all of us go to sleep comfortably while we do have a very big problem among our nurses and our workers, our ambulance drivers, our ambulance people. Kailangan talaga ina-address natin yan. That is the kind of government we have, a respectable government, a government that cares.
Mr.
So I'm
Chair,
glad that you're open to that.
Mr. Chair,
Let me just call before I call Secretary Villanueva, with your permission, Joel, I think it's an act of humanitarian and charitable attitude. I'd like to call a personal experience of Joy Cruz, whose mother died. May nakuha ba kayo, Joy? Are you there? Joy Cruz. Pakita niyo ngayon nagtatanong na. Yung nanay niya nagtrabaho sa Cainta Hospital, namatay, tapos ang nakuha 60 pesos daily hazard pay and dies of COVID before receiving it at umabot lang halos ng 600 pesos lang ata. Joy, can you answer that? I believe in letting everybody air her grievance if there's any grievance at all. Joy Cruz? Ayan ba siya? Tawagan nyo nga. Telepono ako na dyan. All right. In the meantime, while we're waiting for Joy, thank you for your patience, Senator Villanueva. Please go ahead and proceed to ask your question.
Yes, Mr. Chairman. Well, at first, I would just like to interject with the ongoing discussions with regard to the special risk allowance, Mr. Chairman. I think all of us are very clear in the beginning of the hearing that we are here for clarity and transparency. I was about to mention the emergency situation shared by our chair of the Committee on Finance, but naibanggit na po ito ng maayos at clearly. But Mr. Chairman, I think what I wanted to point out clearly is the fact that hindi ho talaga nagamit yung pondo because the DBM is saying na sinosoli na, hindi ho nagamit. So again, yung FNU, binanggit ho kanina, at may mga ospital ho doon na very close sa atin, dito sa ating probinsya. Dami-dami na hong namamatay dito at maging mga healthcare workers, hindi pa rin sila nakakatanggap. Ang DOH sinasabi, nirelease nila pero hindi ho nila ginamit, obviously, dahil yun ang sinasabi ng DBM. Again, we're here for accountability. Hindi talaga nagamit. Hindi ko talaga naibigay yung special risk allowance. At yung iba ho, 6 months na hanggang ngayon, hindi pa rin sila nakakatanggap. So, ang call lang natin is, ano yung catch-up plan? Baka po pwedeng ngayon pa lang malaman na natin ano yung catch-up plan ng department.
Thank you, Senator Villanueva. I'll ask again, Secretary Duque. Dapat one-on-one na lang tayo rito. Pwede ba
Yes, sir. Yes, sir.
Secretary Duque, pwede bang pakihanap mo doon sa department mo kung sino ang pumapalpak dyan na hindi pinapaabot yung pera at i-report mo sa amin dito? Dapat
Yes, sir. Pero may presentation kami, sir. May presentation kami to show kung saan pumunta yung mga pondo. Malinaw kung saan napunta. So we will present that now. If we can share the screen, Mr. Chairman.
I will allow you to do that. Ang hindi ko
Thank you.
maintindihan, you have a tidal wave of people from all across the country saying they were not able to receive. If you make that presentation, if they maintain na hindi sila nakaka-receive, may problema tayo. Kaya kung talaga hindi nakaka-receive, katulad ng sinabi ni Senator Villanueva, which is really very, very appealing to me na dapat ano ang catch-up plan, dapat malaman natin, sino ba sa department mo? Hindi ako marunong manisi. Alam ko, malaki ang problema mo, malaki ang problema ng bayan. Hindi naman pwede isisilat sa iyo yan. Gusto kong malaman, sino saan pumapalpak? Because we are here in aid of legislation. We need to know, saan pumapalpak yan? Nahuli ba ang dating ng pera? Kaya hindi nyo umabot? Meron bang nagtamad-tamad yan? Meron bang iniwan sa regional director, hindi pinaabot dun sa syudad o sa bayan na kailangan bigyan ng pera? Yun ang gusto kong malaman para ma-solve natin, para hindi na mangyayari itong problema ito. Kaya nyo ba yun?
Certainly, Mr. Chairman, yes. We can present that now. Can we share the screen? Para lang ho malinaw sa lahat for transparency.
I hope you can do that because I will really be very upset kung ipapasyal nyo kami because yun ang hinahanap ko. Sino talaga may sala?
Mr. Chair.
Yes, sir.
Yes.
Ito, sir. Can we now share the...
You're recognized. Senator Pangilinan, you're recognized.
Yes, before the secretary answers, just so that he can cover also this point that I'd like to raise in relation to the point raised by the chair and Senator Villanueva.
I will recognize you then, Senator Cayetano, just to make sure that everybody's...
Yes. Dito kasi sa chat box, sinasabi nung Director Badeo ba ito? Na yung mga ospital daw nakatanggap. De Los Santos received 8.9 million. MM Center, 5.8 million. Lourdes, 4.2 million. Director Gloria Balboa was posting it here. Pero yung sulat naman ng ating mga frontliners, sinasabi sa atin na ang sagot daw ng Center for Health Development, hindi daw nag-apply yung mga private hospitals. So iba yung sinasabi nitong Director Balboa, iba naman yung sinasabi ng Center for Health Development. In terms of, sinasabi ni Director Balboa, nabigay yung pera. Sinasabi naman ng Center for Health Development, hindi daw nag-apply yung private hospitals. At sinasabi ng frontliners, wala sila natatanggap. So, baka pwede isama doon sa sagot. Ano ba talaga ang totoo? Nasaan ba yung pondo? Just to reiterate, yung point raised earlier.
Mr. Chairman, if I may, thank you, Mr. Chairman. Thank you, Senator Kiko. Yung si Director Gloria Balboa is the Director of the Center for Health Development. So, isa lang po yung kanyang sinasabi. Yung mga ospital ng mga private entities, no, na mga ito, sila ang actually may accountability. Dahil sila po ang nakakakilala doon sa kanilang mga healthcare workers. So, may proseso ho sila dyan. Meron silang human resource office to properly identify who should be the legitimate recipients of these benefits. And again, if I may ask the good chairperson to recognize Director Gloria Balboa of NCRCHD. She has a lot to say on this. Thank you, Mr. Chairman.
One moment before I do that, I have a policy that all the senators, this is very freewheeling right now. I'm not respecting 5 minutes, 10 minutes. I just want to be sure, kung may question, you will add to the discussion, come in right away. So Senator Cayetano, you have a question, go ahead.
Thank you, Mr. Chair. Mr. Chair, I just wanted to put in the legislative history, as I was the one who sponsored Bayanihan 1 and was very active in Bayanihan 2, and I chaired the budget of the Department of Health, because this legislative history will help guide us to determine what exactly is the policy when it comes to the payment of the special risk allowance. So to start with, Bayanihan 1 very specifically provided for a special risk allowance only for public health workers, okay? And then we passed Bayanihan 2 because the clamor was to include private health workers. So under Bayanihan 2, we expanded the definition and we included private. However, the provision on catering to and directly catering to or in contact with COVID-19 patients was also inserted. And that was upon the request of the administration. So we need to get clarity from both DOH and DBM as to who they were intending to cover when they asked us to include those provisions. Because my recollection is, they specifically said, listen, hindi pwedeng ganun ka-broad dahil ganito kalaki yung halagang yan at hindi kaya. Meron talagang record yan, Mr. Chair. So we need to address that because otherwise, we are basically not confronting that reality that we were dealing with at that time last year. So what is that amount? We need DBM and DOH to tell us what was that amount that they were saying that is too broad. Because kaya may provision. So basically what we are saying is, we are basically saying that either we take out those defining phrases, or we're, as you said, we are expanding it and giving it a very liberal interpretation. But the bottom line is, it goes back to that original figure that they were telling us that hindi nila kaya. So I don't want this hearing to end, tapos later on, saka tayo sasabihin na hindi pwede to. Ngayon na, sabihin na nila lahat. So yun lang naman yung point ko, Mr. Chair, because there was a reason na ganun yung wording nun. We in Congress wanted to cover all of those that had somehow had some exposure. But what was that limiting factors that they were envisions, and what is that amount that we are talking about? Thank you.
Senator Pia, that was settled more or less by the chairman of COA, in that we will adopt. He's in favor, and we are all in favor of having a liberal attitude. Na in connection with the phrase, in connection with COVID-19 patients, because it's airborne, dapat bayaran. Anyway, let's...
No, Mr. Chair, pero my point is, si DBM naman yung magbabayad, yung maglalabas po ng pondo. I noted his honor, the chairman's reaction to that, and I'm good with that. But I'm saying, ilalabas ba ng DBM yun? Kasi otherwise, this hearing will end and hindi pa rin ilalabas ng DBM yung amount na yun.
No, but that's why I asked the Secretary of Health, Senator Cayetano, kung meron siyang savings upon the advice of the Secretary of DBM or the Acting Secretary or the OIC, na sinasabi niya na kung may savings, at sinabi rin ni Senator Angara, emergency situation now, and I said that already in my preliminary remarks, and that there is a problem to be solved and we cannot wait, na we can go ahead and rely on those savings, if any. And if those savings are not there, we should immediately call a special session, if that is necessary, to call it and make and clarify all those, di ba? So let us listen to what Secretary Duque has to say. Kanina pa niya sinasabi na pagsalitain raw yung kanilang explanation. Because pag tinignan nyo ito, ang
Okay.
dami talagang nagagalit na tao na sinasabi hindi sila nabibigyan. So tingnan natin ang sagot ng DOH.
Yes. Can we share the screen to be presented by ASEC Beltran?
ASEC Maylin Beltran po ulit, Mr. Chair. Am I coming in loud and clear po? Of how much have we received for all the benefits? Can I have that slide, please? Sir, again, as mandated by RA 11494, we were able to provide benefits for this period. Ito po, honorable senators, Mr. Chair, and colleagues in the government, we were able to provide for September 15 to December 19, 2020, the benefit for actual hazard duty pay. We were able to obligate 3,357 million po for 384,159 healthcare workers. Na this, of course, according to batas po, ito ay bibigyan lang po yung mga public healthcare workers po natin. For the special risk allowance, we have also obligated 3,211 million for a total number of public and private healthcare workers na 306,314. And then for the provision of accommodation, meals, transportation, we were able to obligate 1,260 million pesos for a total of 103,096 healthcare workers. Again, both public and private po. And then we were also able to enroll 32,281 public-private healthcare workers for an obligation of 16,300,000 po. Opo. So that's it for September 15 to December 19, 2020. Noting po that the Bayanihan Act 2 expired on December 19, 2020. However po, we know very well that that this was extended up to June 30, and we were only allowed by law because of that extension, the granting of the special risk allowance, and therefore this covered the period December 19 to June 30 in the amount of 7,129 million po. Again, for a total number of public and private healthcare workers na 117. So we have the list po. We can share and we can submit po according to regions by virtue of the data submitted by our regional directors po.
Excuse me,
So,
excuse me.
po, sir.
Excuse
Yes,
me,
sir.
Gloria, excuse me. Ano ang base figure niyang AHDB? Accommodation yan, di ba? Yan yung mga pamasahe. Ano yung SRA? Ano yung base figure na 306,000? Ilan yung
Okay.
bibigyan nyo? Ilan percent yung nabigyan nyo?
Okay, sir, ang AHDP po ay hazard duty pay po.
Po.
Again, this is for purposes of giving benefits to people to healthcare workers, sir, who are exposed
I
to.
understand that. All I'm asking is simple. Listen to the question. The question
Yes,
is,
sir.
ano ang base ng 384,000? Ano yung percentage ng kabuuan? Ano yung kabuuan yan?
Sir, let me share with you an initial estimate for planning po. As mentioned by Congresswoman Kimbo, we have submitted to the Senate, to Congress, a total of 517,356 eligible healthcare workers po. But this is really the total number of licensed health professionals all throughout the country, which would then not be all involved in COVID response. So ito po, sir, na-reduce po siya sa actual figure na ho namin na 384,159 because this figure po came from the master list coming down the ground po for health facility for each of our regions po. And these were submitted and consolidated by our regional offices. Yun na po, sir. So the actual number of health personnel who are, of course, public because it's
Maylin, sandali lang, Maylin.
Yes, sir.
Yung 384,000 nyo, ang target nyo is really 538,000. Ikaw mo.
517,356 po. Yung
So,
na-submit po
ibigay yun,
namin.
hindi nyo na ibigay lahat yun dahil ang binigyan nyo lang yung nasa expose sa COVID. Tama?
Yes, sir. Tama po
Pero
yun.
how do you explain na maraming mga nurses na nakikinig sa atin na nanonood na sinasabi hindi totoo yan. Hindi sila nabibigyan. Hanggang sa San Lazaro Hospital, tabi nyo na yan. Sinasabi yan. St. Luke's, Lourdes, lahat sinasabi yan. How do you explain that?
Sir, can we also show you right now, with your permission, sir, the list of hospitals po and facilities for PCR?
Mr. Chair. Mr. Chair.
Yes, sino yan?
Villanueva, Mr. Chair.
Yes, Senator Villanueva, go ahead.
Yes, I'm afraid I don't want to miss that opportunity of that particular slide that she was showing us, Mr. Chair. If we can ask her to, because she's moving forward, I don't want to miss that, Mr. Chair, because in that particular slide, it says 7.1 billion was obligated. It was obligated. The total funding is 9 billion, Mr. Chair. So there's 1.9 billion unobligated. Bakit hindi na obligate ito? And also, Mr. Chair, let's point it out na obligated lang ito, hindi po ito disbursed.
Correct.
That means to say, hindi ito nagamit. Hindi ibig sabihin ng obligated nagamit. Is that correct?
With your permission, sir. Yes, sir. That's obligated. Ang
So, hindi
nagamit
pala
po,
gamit.
ang nagamit po talaga disbursed according to our records is 6.93 billion po.
Okay, 6.93 billion ang nagamit talaga. But the total budget is 9 billion. Is that correct?
9.0.
Yes, sir.
Hindi nagamit. That's why it's kind of a tricky with that particular slide that you showed us. When you said, for example, you enrolled 32,281 dun sa life insurance. And I'm assuming nagamit po yun, na-enroll talaga sila doon. But dun sa sinasabi, obligated, hindi talaga nagamit. The fund is 9 billion. Ang nagamit is 6 billion. And this is emergency funds. I just want to point that out, Mr. Chair. Thank you.
Yes, tama yun. But again, hinahabol ko pa rin
Yes.
yung base figure na sinasabi niya. Dahil it collides with everybody that we're saying na Ultimo San Lazaro Hospital, hindi natanggap lahat. PGH, sinabi, hindi sila nakatanggap. Sino nagsasabi ng totoo dito? Kaya nga sinasabi ko kay Secretary Duque, alamin niya kung anong punot dulo nung sinasabi sa kanya, baka may nagsisinungaling sa kanya at hindi sinasabi ng totoo, di ba? Di ba?
Maylin po. Maylin, sir.
O, hindi ba, Maylin?
Yes, sir. Opo, 9 billion
Coalition
po.
kayo eh. Merong disagreement ng tao eh.
Yes, sir. Sir, yes, we were allotted 9.7 billion for this. We were given this amount released to us through ASARO on June 25. And we had to spend the whole 9.7 billion supposedly until June 30 po. So ilang araw lang po yon. May mga kailangan ho kaming isettle na mga MOA, kailangan ho namin kausapin yung mga private sector, kailangan ho namin kausapin yung mga iba't ibang LGU hospitals
Yan.
po.
Yan ang sinasabi
Yes,
ko kanina kay Secretary Duque. Ang sabi ko, baka nahuling binigay yung pera, kaya hindi nyo nagastos. Now,
Yes, sir.
na-realize na. Ibig sabihin,
Yes.
mabagal yung pag-release ng pera. By the time you na-release yung pera, hindi nyo na makahabol dahil hahanapin nyo pa yung mga tao o tumaas na yung presyo kung may bibiling kayo, kaya nagkakaloko-loko. Tama ba yun?
Yes, sir. Tama po yun.
Binigay yung pera sa inyo June 25,
Yes,
tapos
sir.
kailangan magagastos nyo in 5 days, magagastos nyo yun?
Yes,
Hindi
sir.
nyo kaya yan. So yan ang rason. So sino yun? DBM.
Yes.
Friday, ha? Sabi mo.
Yes, sir. June 25 was a Friday. We had to immediately talk to our partners Saturday, Sunday po, nationwide. And of course, we had to spend this kasi po, sabi nga ho na ng batas, obligated and disbursed by June 30.
Precisely.
Yes,
So
sir.
the inefficiency is within intra-government. Hindi mo nabibigyan ng DBM on time, tapos pipilit kayong tapusin nyo on a weekend pa, gagastusin nyo at i-obligate nyo in 5 days na may weekend pa. Tama ba yan?
Yes.
Yes, sir.
Malinaw na sa akin yan. O sige, tuloy mo iba. Kasi ang hindi mo maipaliwanag sa akin, ay nagsasalita ang mga tao, matapang na ngayon, sinasabi nila, uy, hindi kami nakakatanggap dyan. UP, hindi nakakatanggap. Gordon Memorial sa Olongapo, hindi nakakatanggap. Sa Baguio, at iba pa, hindi kami nakakatanggap. That collides with what you're saying. Kaya gusto ko malaman sino nagsasabi ng totoo. That's why I asked Secretary Duque, paliwanag mo kung saan magkakaroon ng pagkakamali. Please,
Yes,
go ahead.
sir.
Tuloy mo na.
Tuloy mo na. I will do that, Your Honor.
Yes, sir. So, sir, yan po yung kabuuan ng ating benepisyo na naibigay noong September 15 to December 19, 2020, and then December 19, 2020 to June 30, kung saan SRA na lang, sir, ang pwedeng maibigay. Yun po, sir. Sir, can I have an additional slide po just to show
Sure.
that we have some details po for Metro Manila Center for Health Development. So ito po yung
Excuse me lang, Mary, no? You don't
Yes, sir.
expect us to take your word for it that just because nakalagay yan dyan, totoo ang nangyari yan. Kailangan patunayan nyo sa amin na naibigay talaga doon sa mga tao yan. Kasi maraming
Yes, po.
pupunta sa sinasabi nyo.
Yes, sir. Sir, may mga memorandum of agreements po tayo with all of the private health facilities. And of course, certification coming from the chief of the health facility po, sir. So with your permission, sir, kasi this is a data coming from CHD Metro Manila. Nabanggit na rin naman ho si Dr. Global Balboa kanina, Gloria Balboa po. Siya ho ang explain po nito, sir.
Just a moment, I see Senator Recto just came in.
Yeah.
Go ahead, Senator Recto. We will allow Mylene to continue, but you have a question in connection with what she's saying?
Yes, Mr. Chairman, thank you for recognizing this representation. But on the same issue, Mr. President, Mr. Chairman, we are talking about the benefits given to health workers, no? there are 8 benefits. So maybe when the DOH makes a presentation, let us complete the picture. There are 8 benefits under the law for our health workers. And we all know that the most important component in our fight against COVID is our human resources. Okay? And that's why we put in Bayanihan 1, Bayanihan 2, and in the budget for 2020 and 2021, more or less ang budget ng DOH is 540 billion. 2020, Bayanihan 1, Bayanihan 2, and general appropriations for 2021, Mr. President. No? So what are the 8 benefits? Para kompleto sana yung presentation ng DOH. One, napag-usapan dito yung actual hazard duty pay. Okay? The second is the special risk allowance. So yan, napag-usapan na rin yan. But then we put under the law also mandatory testing for our health workers. No? We also have tax-free compensation for public and private health workers who have contracted COVID-19, 1 million for disease, and I think that was incorporated because of Senator Gordon, 100,000 for severe and critical, 15,000 for mild and moderate. So ilan ba yung tinamaan ng health workers natin at nabibigay ba ito? No? Free hospitalization for public health workers. And then, of course, provision of PPE for all our health workers, life insurance, accommodation, transport for public and private during state of national emergency, and so on. So, basically, there are 8 benefits. No? Yan ba naibigay natin lahat sa ating mga health workers? So, thank you, Mr. Chairman.
Thank you. Ralph, thank you, Senator Recto. Now, very important. I want, Mylene, no? Pagpatawad mo. Pag tinanong ko ang nurse ngayon, pag tinanong ko si Jocelyn, pag tinanong ko, sino pa yung iba mga gusto magsalita? Ano sasabihin nyo ngayon pag sinabi nilang hindi totoo yan? O, sige na, talangin natin. Jocelyn, totoo ba yung sinasabi? Umabot ba sa inyo yung sinasabi ni Mylene?
Yun nga po ang problema. Yun nga po ang problema, Honorable Chair. Napakarami po ang mga nurses at iba pang manggagawang pangkalusugan ang hindi po talaga nakatanggap ng mga benepisyong mga nabanggit. SRA, Active Hazard Duty Pay, hanggang sa ngayon. Nandito po kasama natin ang Pangulo ng Alliance of Health Workers, si Mr. Robert Mendoza.
Okay, Robert Mendoza, you're recognized. Anong sasabihin mo?
Okay, maraming salamat po, Mr. Chair, at saka sa lahat ng mga nandito po sa ating webinar po. Pwede kong i-present yung sa lahat ng mga hospital sa government na kung sino yung nakatanggap ng SRA, kung sino ang hindi, para pwede kong i-share po itong ating PowerPoint presentation.
Yes, may pinakita kanina yung hindi nakatanggap eh. Pero pakinggan mo, Mylene, ha, para tama yung sinasabi mo. Go ahead. Make it quick, please.
Hindi po. Paano kaya i-share to? Wait lang po. I-share ko lang po. Lang po ha. Mag-share lang po ako.
Sir, Mr. Chair,
Yes.
may po ulit, sir. Sir, hindi pa ho ako tapos mag-present. Can I still be given the opportunity to present siguro 2 more slides, sir? Before Mr. Robert will show his...
I will allow you to do that. But sige, in fairness to you, we will listen to you and show it. And then Robert, ihanda mo, hindi ka pa naman ready do sa ipipresent mo. I-ready mo na kagad. Go ahead, Mylene.
Maraming salamat po ulit, Mr. Chair. Sir, ito yung gusto ko lang hong i-present yung timeline. I think these are very important dates that we need to share with everyone. Na-point out na rin ho kanina na may lags ho in some areas. And I take note po of Senator Recto's comment po on the 8 benefits, but I'm just zeroing in ho doon sa 4 po, plus ikalima ho yung compensation na slide ko ho mamaya. So this is the timeline po for the granting of healthcare workers benefits that's due for granting September 15 to December 19, 2020. So with the indulgence of everyone, I will walk you through some important dates. September 11, the RA was signed, and DOH requested for 32,369,000,000 po to cover our health-related responses po, including the granting of healthcare workers benefits. On September 17 po, we were given an approved appropriation of only around 13,401,000,000 for health-related response, including healthcare workers benefits. So kung titignan po natin, honorable senators, we have a difference of around 18,732,000,000 from our requested funding of 32.3 billion po. And then on September 25, we were able to meet with DBM on the submitted details of the breakdown of the 13.5 billion, wherein DBM also presented their own proposal po for SRA and AHDP. And then on October 27 po, we received a letter from DBM on the advice of SARO amounting to 20,575,000,000. The 13.5 billion of which is part of this po for health-related responses, including granting of healthcare workers benefits. And on November 16, 2020, there was an issuance coming from OP on AO 35, again for hazard pay, and AO 36 on special risk allowance. And then on November 25, DBM DOH issued a joint circular number 1 and 2, so as we will be guided by we will be guided on the implementation of all these healthcare workers benefits. And on November 26 to 27, we have already downloaded funds to our various centers for health development, DOH hospitals, and other concerns. Noting po that the Bayanihan Act 2 at that time would be expiring on December 19, 2020 po. And then another slide po, Sir Chair. Again, this is the timeline for our healthcare workers benefits that are due for granting from December 2020 to June 30, 2021, again by virtue of the extension of the Bayanihan Act 2. So on April 8, sir, as you can see sa slide po, we sent a letter request to DBM for funds for SRA and active hazard duty pay funding for the provision of these benefits amounting to 16 billion pesos po. And then May 5, we received a letter from DBM denying the request for funds for these benefits due to lack of legal basis daw po. So forcing the DOH to appeal to the Office of the President to issue policy on the continuous granting of these benefits po, particularly SRA and AHDP po. And then on June 1, 2021, AO 42 on the special risk allowance was released by the Office of the President. On June 16, 2 weeks after po, DBM and DOH had to issue a joint circular prescribing the amended guidelines on the continued grant of the COVID-19 SRA to public and private health workers directly catering to or in contact with COVID-19 patients during the state of national emergency. So again, naayon ho sa batas po yun, Mr. Chair, na gaya ng sinabi ho nyo kanina. And then on June 25, that same day, we received June 25, we received the SARO po from DBM, and only for 9 billion pesos for special risk allowance. Again, our request was 16 billion to cover both EHDP and SRA, but we were given, of course, 9 billion for SRA only. And then right on that same date, we processed sub-allotment guidelines. We talked, syempre po, sa lahat ng various heads of our health facilities, our regional directors. On June 25, the same day po, and this was a Friday, we signed sub-allotment guidelines and we disseminated for guidance to all our health facilities, to our regional offices. And that during this time, June 25, we were still receiving po, Mr. Chair, additional requests for additional benefits for some health facilities po na hindi pa ho nakakapaggawa ng MOA, Memorandum of Agreement. Again, sir, if we have to transfer funds to a private health facility or to an LGU facility, we have to have Memorandum of Agreement per our auditing and budgeting guidelines, sir. And then on June 25, we processed sub-allotment advice and disseminated to all health facilities. And noting that on June 30, the law will expire. So lahat ho na makakaya ho namin, ginawa ho namin para ma-disburse and makarating po talaga sa healthcare worker yung karampatang SRA ho na dapat nilang ma-receive. So that's why yung explanation ho din kanina po na 9 billion, 9.7 exactly, 9 billion, 7 million was given to us as an allotment. However, again, due to time constraints po, we were only able to disburse with healthcare workers receiving SRAs amounting to 6.7 billion po. And that was done in a matter of 3 days, actually, sir, from Friday. Yun po, sir. And then, sir, one more slide, sandali lang po. For the compensation, again, this is one of the compensations due a healthcare worker. So dito po, honorable senators and our government officials, we were able to provide these benefits under Bayanihan 1, again, sickness and death benefit compensation, which is part of our RA 11494, from March 24 to June 24, 2020, we were able to provide 114 public and private healthcare workers who got sick, who died of this of COVID in the amount of 62.7 million po. And then Bayanihan 2 from September 15 to August 16, last Monday lang po. We were able to provide compensation to 23,331 healthcare workers amounting to 493.9 million po. Again, for a total of 556.6 million. Yun po, Mr. Chair, maraming salamat po sa pagkakataon na to. Thank you po.
I will recognize Senator Marcos shortly, and then of course, Mr. Mendoza. But ang sinasabi mo, Mylene, binibigyan kayo, huli na nga, kulang pa. Tama?
Sir, opo sir.
At pinagmamalaki mo, hindi naman insulting yon, sinasabi ko lang, pinagmamalaki mo, pinapaabot yung pilit, pero hindi nyo matapos dahil sa kakulangan ng panahon.
Tama po sir. Sir, hindi ho naman po pinagmamalaki po. Stating facts lang po.
I chose the wrong word. I apologize. Ang sinasabi mo, hindi nyo matapos, di ba? Hindi nyo matapos dahil kulang na. Tapos, ang problema pa, you are relying on the bureaucracy na kailangan may mga MOA pa kayo, di ba? Para mabigyan yung private sector, right?
Yes, sir. Tama po yun, sir.
Kaya you are dragging anchors. Kumbaga kung may dala kayong angkla sa leeg ninyo. Hindi nyo mapigil.
Yes, sir.
Ha?
Yes, sir.
Okay.
Because we know we're using people's money and we want to be very diligent in the use of all these funds po.
No, you are very diligent because COA will go after you if you do not do that.
And yes, we know that also, sir. We also know that, sir.
Alam ko yan. Alam ko, galing ako sa gobyerno. Sa local government. So, ang point ko ngayon dito is, hata sinasabi mo magandang pakinggan, pero ang kailangan masagot sa committee, bakit hindi umaabot yung pera, sabi ng mga nurses sa kanila. Yan ang gusto ko malaman at mamaya mangingi ako ng advice sa lahat ng senador at saka sa COA kung paano natin malalaman yan. Ako, I have an idea. But in the meantime, bago ko tawagin Secretary Mendoza, si Mr. Mendoza, Secretary Marcos, are you going to pursue the point? Or if it's another point, I will ask you to wait and let Mr. Mendoza answer the point.
Yes, thank you very much, Chairman Gordon. I'm going to proceed to another point, which is why please go ahead and ask me
permission.
Mr. Chair,
Mendoza,
Mr. Chair,
yes, sir.
if I may just
Ingin ko
10
muna
seconds,
Mr.
Mr.
Mendoza
Chair,
sandali,
10 seconds.
para hindi tayo nahihiwalay, okay? And then you will have your point, and then we will pursue that point. Okay? Now,
10 seconds.
Mr. Mendoza, go ahead. Joel, do you have something to say? Senator
Yes,
Villanueva?
yes, 10 seconds, Mr. Chair. 10 seconds lang.
Okay. 10 seconds to shoot.
Yes, Mr. Chair, maganda ho yung sinasabi na presentation ng DOH. I just want to point out and spread it to the records. Ang bayanihan to ho past September 11, 2020. So, if we are ready about it, nagawa na natin yun, naayos na natin, naplansya na natin yung mga dapat natin. I just want to point that out kasi hindi naman totoo na parang 5 days lang yung preparation at ayusin at i-disburse itong 9.02 billion pesos. I don't agree with that. Just want to put that on record, Mr. Chair. Thank you.
Well, those are my sentiments exactly, and I'm sure that's the sentiment of, I was looking at the COA chief. Talagang imposible talaga yan. Mission impossible. Di ba?
And we work hard for it, Mr. Chairman. We work
Correct,
hard
correct. Ibig sabihin, meron talagang inefficiency at kulang sa vision. Ang DBM, kulang sa vision rin. As the Department of Health, dapat pinupukpok nila yan. Oy, matatapos na, hindi nyo binibigay. Now, let's listen to Mr. Mendoza because kanina pa rin na gusto magsalita niyan. Gusto ko marinig natin ang nurses para pag natapos natin to, yung iba tatalakayan na natin, yung ibang mga kakulangan para hindi na masama ang loob ni Secretary Duque at malalaman natin kung guilty or not guilty siya. Okay? Mr. Mendoza, go ahead.
Okay, ano ba yun?
Go ahead, are you ready?
Yeah, I'm ready.
Yes.
Sana yung ano?
Sana yung ready ka tapos hinahanap mo.
Okay po yung audio ko, sir?
Sige po.
Okay. Ito po yung mga nasa government hospitals na lahat ng mga hospital ay merong nakatanggap, merong hindi po. So, pag-usapan natin yung special rest allowance na dapat 5,000 for 22 days. Other hospitals, kasi kinausap ng ating mga unions, ang mga director, na dapat lahat sana ay makatanggap kasi alam natin na high risk ang hospitals. Ito yung pinag-uusapan kanina. So, ang ginawa ng ating mga directors, diniklara nila na ang kanilang mga hospital ay high risk. Kaya lahat ng empleyado ng hospital ay nakatanggap ng SRA. Maliban lang sa ibang mga director na talagang sinundan niya yung batas, parang exclusive lang talaga daw, kagaya ng San Lazaro Hospital po. Ang kanilang director talagang hindi binigyan ng SRA yung mga other health workers, except lang yung mga nasa COVID area. Pero dapat ginastify niya dahil infectious yung kanilang hospital, dapat ginastify niya na pwedeng lahat ng health workers ay pwedeng bigyan. So, kung isa-isahin natin ang mga hospital sa specialist allowance ay mayroon from ang PGH po, ang sinabi kanina ay ang kanilang area ng nabigyan ay yung COVID area lang. So, ang ibinigay sa kanila ay binigay sa kanila yung COVID area lang from September to June lang po sa COVID area. Pero yung September to December 20 ay naibigay sa non-COVID areas. Tapos, ang kanilang active hazard duty pay ay hindi pa ibinigay. Ang ibinigay lang ay September to December 2020. Ang kulang pa ng Department of Health ay from January to June 2021. So ito yung mga kakulangan din po. And then, ang karamihan sa ating mga health workers ang may kulang pang Department of Health dahil 3 days after na ni-release yung budget para sa mga hospital para sa meal, accommodation, transportation, ay binawi ito ng Department of Health kahit hindi pa nagamit ng mga hospital yung kanilang meal allowance, accommodation, transportation. Like for example, yung si Reyes ay binawi ang kanilang budget for MAT, 56 million, ang Fabella ay binawi ay 59 million, ang Tondo Medical Center 20 million, ang National Center for Mental Health 62 million, at marami pang mga hospital na binawi po nila yung nirelease nilang budget. Kasi kailangan daw yan sa mga paggagamit, meron pa daw silang paggagamitan sa Department of Health ng mga para doon sa COVID response. Pero nung nakita natin ang COA findings, marami pa palang pera ang Department of Health at saka dapat ibinalik ito ng buo doon sa mga hospital po. Kasi ang ibinalik lang nila nung nanghihinap tayo ay 30% lang doon sa kinuha nila sa mga hospital, itong mga budget na ito. Kaya ito yung mga kakulangan na talagang may kulang pa talaga ang Department of Health doon sa pagbibigay ng meal, transportation at accommodation allowance. Kasi ang ibinigay lang sa kanila ay 30%. Saan napunta yung 70% for the accommodation transportation? So, nung siningil na natin ng Department of Health, sinabi nila, nagamit na ito para doon sa COVID-19 response. So ito yung mga kaya nga dito sa unang pagbibigay po nagkalituhan ng mga director kasi hindi rin malinaw ang department order ng ating department level kung paano ba ibibigay itong meals, accommodation, transportation. So ang iba ay nagbigay ng groceries, nagbigay po ng cash gift, gift check. Tapos nung ating pangungulit with the Department of Health ay sumulat ang Department of Health sa Office of the President at ito ngayon, noong June 1, naglabas na ang Office of the President na gawin ng cash equivalent. Kaya yung iba, nabigyan sila ng cash. Yung pinakahuli na po, lalong-lalo na yung mga nasa GOCC kasi obligated na yung kanilang mga pondo at natira pa. So ito yung hinanakit ngayon ng mga health workers kasi hanggang ngayon, dahil alam natin na may pandemya pa naman sa kasalukuyan, hindi pa rin nabibigay sa lahat yung kanilang mga meal, accommodation, and transportation from January to June 30. Ito yung sinasabi ng ating Department of Health na nag-request sila sana ay tuloy-tuloy sana ang mga benepisyo ng ating mga health workers. Kaya ito rin yung inaantay ng ating mga health workers from the public sector na dapat dahil may pandemya na, may Delta variant na, may Lambda na, sana mabigay ng tuloy-tuloy yung benepisyo ng ating mga health workers. Yun lang po. Maraming salamat.
Let me ask you a simple question before I go to Senator Marcos. Tama yung sinasabi mo, kulang ang binibigay, hindi pa umaabot, kaya maraming hindi nabibigyan. Tama?
Yes, tama po yan, Mr. Chair.
Alam ko ang problema ng DOH, gusto lang ibigay, kulang rin at hindi sapat. Tama?
Tama po.
At hindi nila mahabol dahil huli na binibigay. Ang
Tama po
tanong
yan.
ninyo ngayon, hindi ba pwede, Secretary Duque, yung mga tao mo at saka ito mga asosasyon ng mga hospital nurses at yung mga tao yan, meron kayo talagang committee para sabayin yung ginagawa para walang malalampasan. Hindi yung ngayon na lahat nagke-claim hindi sila nabigyan. Hindi natin malaman ngayon kung ilan talaga hindi nabigyan. Dahil kung kasama nyo lahat yung association, madali nating malaman kung sino ang nabibigyan at hindi nabibigyan. Pwede ba yun? Sir, sa inyo side, Mr. Mendoza.
Yeah, tama po yun. Dapat kasama sa mga pag-uusap yung ating mga hospital unions kasi alam naman natin na part tayo doon sa kabuuan, mas malaki ang ating kasama sa rank and file. Dapat kinukonsulta din dapat ang mga hospital unions.
Hindi kinukonsulta. Ito, sabihin sa inyo, ito ang pera namin. Kasama kayo dyan, ito ang bibigyan. Ito mabibigyan, ito hindi mabibigyan. So alam nyo na kagad, magpapaliwanag na kayo. Pwede nyo i-prioritize. Saka na muna yung hindi kailangan, yung laundry or whatever, unahin natin itong maibibigay para meron kahit na paano. Pwede ba yun?
Pwede po yan para mas maganda po yung yung daloy ng pagbibigay ng mga benepisyo sa mga health workers. Baka pwede, Mr. Chair, baka pwede magsalita si Ma'am Karen from PGH po.
Yes, of course. Teka muna, kayo tinatanong ko, ikaw nagsalita eh. At tatanungin ko ngayon, Mylene at saka si Secretary Duque, have you tried working with the nurses para hindi kayo nakakagalitan at hindi kayo nasisiraan? Dahil kung kayo, kinakausap nyo sila, malayo pa, nakikita nyo na yung problema na hindi umaabot, di ba? Hindi nasisiraan ang tiwala ng tao sa gobyerno dahil alam nyo, yung bibigyan nyo, kasama nyo, at alam ng mga tao nila na ginagawa nyo lahat ng paraan na malalaman nila kung kulang talaga yung pera. Tama ba yun, Secretary Duque? Pwede ba yun?
Oo, tama naman yun, Mr. Chairman. In fact, doon nga sa provision ng meals, no? Ako po ang sumangguni sa Office of the President na nakipag-meeting ako sa Alliance of Healthcare Workers para kumbinsihin ang OP na yung provision of meals, hindi lang yung pagkain. Kasi napapanisan nga nabubulok. Siyempre, duty sila. Ang tagal-tagal nila sa mga trabaho. Tapos, pagka hinanda yung pagkain nila, kawawa naman po sila. Kaya,
Secretary Duque, you're straying. All I'm saying is have a working relationship so that the people that you're supposed to serve, malalaman nila, dahil may representative sila doon, nag-uusap kayo, hindi nagko-consult, alam nila, itong pera, itong darating, kailan darating, at kulang ang binigay, para hindi masisisi lahat kayo. Para kung kapos sa DBM, yun ang hahabulin. Tama ba yan?
You're right, Mr. Chairman. Nakikipag-meeting naman po yung akin Chief of Staff, si Undersecretary Bong Vega and Assistant Secretary Romy Ong. So pinapaliwanagan naman po sila tuwing na andito sila sa harap ng Department of Health at kinakausap po sila at pinapaliwanagan po sa kanila kung ano po yung talaga mga kakulangan.
Hindi nga,
sa budget.
magbigay alam nila at masasabi nila sa mga miyembro nila. Anong tataka ko? Bakit sasabihin ng San Lazaro, katabi nyo lang yan, hindi nabigyan? Totoo ba yan?
Nabigyan, we have the document to prove that San Lazaro received their SRA, their benefits, no? So we can just send you all the documents in the list of those who accepted or received.
I strongly suggest, tawagin nyo sila, yung mga San Lazaro, at paliwanag nyo sa kanila, marinig namin, ito, nabigyan na kayo niyan. O, ayan. Para malalaman, marami yan eh. Magkakaroon, we don't have the time to do that, but you really have to make sure that you do your homework and they do their homework para hindi mabigyan, mahahabol natin kagad. Alam natin kung sino hindi nabigyan. Tama ba yan, Mr. Mendoza? Okay ba yun?
Tama po yun. Meron po tayong nurse from San Lazaro. Baka pwede siya magsabi. Si Ma'am Jamie.
Sabihin mo, sino yan?
Po. Ma'am Jamie de Guzman.
Jenny de Guzman, please speak up. You're on mute. You're on mute, Jenny.
Naka-mute.
Yes, Your Honor.
Go ahead po.
Yes po. From San Lazaro Hospital, meron pa po kami as of now naka-pending na request, additional budget for the SRA, especially sa mga nurses namin na nabigyan yung iba pero small amount, hindi yung complete amount ng SRA ang natanggap nila. And wala pa pong balita kung ano ang status nun from DOH, kung maibibigay pa ba siya o hindi. So, malinaw po kasi na napakaliit ng time po na binigay.
Jamie, kung 100 ang nurse doon, ilan ang nabigyan sa tingin mo? At kulang pa?
Yung percentage po, let's say maybe 80% ng nurses, 20, or let's say 90% out of the 400 plus na mga nurses, yun yung mga nakatanggap lang.
So nakatanggap,
kasi
so 10% na lang
so much, Sir, Your Honor, kasi ang dami po talagang attachment and it made us difficult to justify. Ang hirap po na humingi ng benepisyo nakalagay sa batas pero ang dami pong dapat ipaliwanag na kailangan pang i-justify namin na i-justify kung bakit kailangan makatanggap when it is obvious na talagang sa patient care naman yung mga nurses. And aside from that, yung nabanggit niyo po, Sir Gordon, yun sa ambulance driver po, wala pong nakatanggap na mga taga-ambulance driver. Talagang piling-pili lang. The director was afraid to justify.
Kaya nga sinasabi ko po, mag-usap kayong maigi para pag ito na yung pera, masasalansan na yan at kung sino mabibigyan, malalaman natin kagad at bakit hindi nabigyan yung hindi nabigyan.
Mr. Chair.
I agree po, Senator. At saka sana po yung pakikipag-usap namin sa DOH, hindi yung laging kami yung nagre-request ng dialogue dahil meron kaming reklamo. Tama po yung suggestion nyo na prior to that, na bago pa magkaroon ng issue, sana po may consultation na, may committee na members ang mga health workers para meron na kami agad say.
In the period of the pandemic, meron ka talagang office na araw-araw nakikipag-usap dyan sa mga, yan na hindi na sila makikipag-appointment. Di ba, Secretary?
Yes, sir. Yes, sir. We will do that. We will make sure that there will be a regular meetings and consultations with the
palagi para kung may magko-complain na andun, malalaman ka agad and then re-reviewin ng alliance kung sino hindi nabibigyan. At masasabi ngayon formally sa inyo na hindi kami nabibigyan, yung mga drivers namin hindi nabibigyan. Yes, Senator Pangilinan?
Yes, very quickly before we proceed to another item, may dalawa kasing hindi nasagot sa tanong ko at meron pang isang tanong on that matter. Siguro yung unang tanong, can the DBM confirm and explain bakit June 25 nila binigay yung hinihingi sa DOH? Ipaliwanag po nila bakit ganun. Do they confirm that and explain why? Second, so hindi totoong hindi nag-apply yung mga private hospitals. Hindi pala totoo yun. Ang totoo, nagbigay pero hindi kompleto o hindi o kulang yung ibinigay na sinasabi ni Ms. Director Blando na 5.8 million, 7.2 million. Tama po ba yun? Clarify lang. Kasi sinasabi nung ating mga yung alyansa ng health workers, ang paliwanag, kaya daw wala, ay dahil hindi nag-apply yung mga private hospitals for these benefits?
Sir, may the chair allow me?
Please go
Because-
ahead. Go ahead.
Yes, sir. Just to clarify the previous timelines that the ASEC from DOH mentioned, the AO, actually sir, yung 13.5 billion lang ang release out of the request. Yun po kasi yung nakalagay sa batas. So we are limited by the law itself. So we release what was included in the law. So 13.5 billion po yon, ni-release po namin buo yung 13.5 billion. After that, sir, nagkaroon ng AO because may limitation yung pagbigay ng SRA. So nasubmit po yun ng June 1 at nailabas po yun ng DBM, nailabas po ng June 1 from the Office of the President. June 3 ho, natanggap ng DBM yon. At pinirmahan din ho nung araw na yon nung aming previous secretary. Umabot po ng June 16 sa DOH, pirmahan yung joint circular. Pagkatapos po nun, ang submission po nila ng request is June 23. So, hindi naman ho kami pwedeng mag-release without the request. So, ililinaw ko lang ho yun dahil yun ang kulang dun sa pagsasaad ng kwento ng taga-DOH that they submitted the request on June 23. Being a holiday June 24, we released the document but it was antedated to June 25. So yun lang po yung kulang dun sa kwento, just to put things in the proper perspective. Thank you, Your Honor.
But obviously, you're all victimized by bureaucracy.
Yeah.
That can be solved.
Yeah.
That can be solved, right, Madam Secretary, Future
Yes,
Secretary?
Yes, sir. Yes, sir.
Huh?
Opo.
You can afford that, right?
Yes, sir.
At
Okay.
yung pangalawang tanong lang, Mr. Chair, yung ano ba talaga yung dahilan? Iba-iba yung sinabi kasi ng alyansa na hindi daw nag-apply yung private hospitals para dun sa special risk o yung allowance. Pero sinasabi may ni-release naman daw, sabi ng DOH. So ano ba ang totoo is hindi na-apply, nag-release?
Sir, with the permission of
Mr. Chairman.
everyone, may I be given 5 minutes to withdraw for a while? I just have to have a commitment in my office. And can you handle it, Senator Kiko? Unless you want me to suspend, can you continue with the hearing para hindi tayo masayang?
Yes, please. With the permission of our other colleagues. Anyway, the majority leader is here. He can preside.
Senator Vergara is my vice chairman.
Kiko is a lawyer. I think he'll be aptly capable of running the Blue Ribbon Committee, of course, while waiting for the chairperson.
We
Maybe
will
recognize the Mr. Chairman, presiding officer.
we will take over for 5 minutes as requested by the Blue Ribbon Chair.
I appreciate it very much. Thank you. Please don't forget to recognize Senator Marcos because I'm sure
Yes.
such a good point. So, thank you.
Chairman, on the same issue lang.
Go ahead, Senator Zubiri.
Yeah, thank you for everybody's information. I was able to get a letter from a friend of mine, Dr. Jose Rene de Grano, the president of the Private Hospitals Association, chairman. And I had asked him, we spoke for a long time last Monday evening, and he wrote to me. I asked him to write me formally. And this is the result of his interviews with all the private hospitals. So he says here, when Secretary Duque mentioned in his interview that the benefits of healthcare workers are already with the different hospitals, I tried to ask, and I'm quoting, I tried to ask some of our members in the different regions if it is true. I found that in Region 1 and 2, a lot of hospitals have already received their SRAs, in fairness. Second tranche, although some were not able to apply for the first tranche. In Region 3, and I think Senator Villanueva would be interested in this, in Region 3, Bulacan hospitals have not yet received their SRAs, according to his survey. A lot of them were not also aware of the benefits. And then in Calabarzon area, most of our Region 4 hospitals, if not all, in Batangas, Quezon, and Laguna, have not received their special risk allowance, mainly because these are being held in the DOA regions or provincial offices and have to pass through the LGUs before being distributed to private hospitals. Dadaan pa ng LGU. Some hospitals in Samar and Leyte have not received also their special risk allowance, Region 8 particular, while some hospitals in Region 6, Iloilo area, have received first tranche and second, no report on Region 7. Although we've spoken to people in Panay Island and they still have problems there. In Mindanao, Region 12 hospitals, according to Dr. Deglano, also have not received their SRAs, and they say it is still with the DOH region or provincial offices. And they were informed that the checks were ready for distribution. Same is true with Zamboanga hospitals. So clearly, it's a bureaucratic mess, Chairman. And finally, the last two paragraphs. Most of the government facilities and hospitals have received their SRAs, especially in the NCR. So sa gobyerno ng hospital, nabigay na po daw itong mga SRAs according to the dear doctor. Most of the hospitals in NCR have also received their SRAs, although we saw the complaint given by the St. Luke's union. The question is, why does the SRA, the special risk allowance, have to pass through the LGUs? According to the doctor, imagine the LGUs have to make a board resolution. In other words, I guess it's a council resolution, and another MOA with the private hospitals before releasing the SRAs to them, notwithstanding that the MOAs that we are giving the DOH provincial offices. So some hospitals have been waiting for weeks for the LGU to act on the SRA, special risk allowance. The funding comes from the DBM, and the question is, why does it have to pass through the LGU and not directly to the DOH, to the private hospitals?
Okay.
So siguro yun ang tanong, Secretary Duque and Mr. Chairman, why do the funds have to be also given to the LGUs when they go directly to the private hospitals? May we ask that question, Mr. Chairman, to the
We
department?
have the secretary or his representative who may be able to answer that, those series of points raised by the majority leader. And my question also, that they did not apply, or these private hospitals did not apply. That's why they did not get the allocation. Can that be clarified, please?
Yeah, thank you very much, Mr. Chairman. May I ask that you please recognize Director Gloria Balboa of NCR CHD to answer your question, and then the next one will be Director 4E, Director Ed Hanairo. So si Gloria Balboa po na, Mr. Chairman. Salamat po.
Go ahead, Director Balboa.
Yes po. Good afternoon po to everyone, Mr. Chair, and of course, Sec Duque. For NCR po, for the second tranche, we were able to release to 90 private and public hospitals po and laboratories. Out of these po, 69 are from the private hospitals, and then 4 private laboratories, and all our local government unit hospitals are able to receive in cash po on June 30. So nabigay na po lahat yon, including those that I've mentioned in the chat box. And we were able to release a total of 901 million plus po in a matter of 3 days. Okay, now it is, let me just emphasize that the list of beneficiaries came from the health facilities, from the hospitals. Sila po ang nagsubmit sino yung mga eligible beneficiaries based on the guidelines of DOH and DBM. So whatever they submitted to us as the number of health workers together with the corresponding amount, yun po in full binigay po namin. So it is possible that those who are saying that they have not received, hindi po kasama doon sa list that was submitted to us. But we provided that money to their hospital. Okay. And then meron din pong mga hindi po nag-submit on time because the deadline was June 30. So there are still 16 facilities that we requested additional funding kasi nag-lapse na nga po from DOH and DBM. And also, there are still 5 facilities which have already received but have requested additional dahil meron daw idadagdag doon sa list. And just the same, we have requested that to DOH Central Office and to be submitted then sa DBM. So hinihintay pa po namin yun, sir. So that's
Okay,
what happened
that is
po sa
yes.
NCR.
Thank you,
And
Director
just to
Balbo.
add, ang
Thank you
sakop po ng NCR are of course the local government units under NCR, 17 po yun, together with all their LGU hospitals and all the private hospitals. So yun naman
Yes.
pong DOH hospitals ay sa kwan po sa DOH Central Office po. So yun
Okay,
po sir,
thank
thank you.
you, Director Balboa. Just very quickly, the next one to present would be direct for the rest of the country. Yung questions raised by Majority Leader. Who is the director again? Who is the next director? Okay, go ahead.
Actually, directly answering your question or issue, we can only transfer funds from the national government to the local government through a memorandum of agreement. But the problem there, they have to go under a process na sanggunian ang they will have to allow the governor, kasi sila yung may-ari ng mga district hospital eh. So they have to allow the governor to sign. So that's one. Now, with the private hospital,
Chairman, just for clarity, Mr. Chairman, Director, the funds that we're talking about are for private hospitals. I understand there are government, local government-run facilities, just like Bukidnon, meron po kami marami. But I'm talking about the private hospitals here. And they're wondering why, bakit pa dadaan sa local? Is it true? First, if you can answer the question, is it true for the provinces that the funds for the private hospitals are given to the local government units for disbursement? These are for privately owned hospitals?
It's not happening in Calabarzon. We go directly to the private hospital memorandum of agreement. And still, they have to undergo a lot of process also before they can agree with us.
Okay, Director, nobody yet is answering my question about the LGU. So in Calabarzon, what you're saying, Director, kayo sa Calabarzon DOH ang pondo binibigay nyo sa private hospital directly. Tama?
Directly, right.
Po yan. And whether it's LGU run or private hospital. Bakit yung complaint ng ating presidente ng ating private hospitals, Private Association Hospitals of the Philippines, say that in other regions, particularly the far-flung regions which I mentioned earlier, the Mindanao regions, together with Region 8 and other regions, it's still with the local government units. So who can answer that, Secretary?
Secretary, go ahead. What is?
Yes, Mr. Chairman, thank you. May I request that Director Annabel Yumang answer that question. Director Annabel Yumang, please recognize Mr.
What is her
Chairman.
designation? Just so that we know.
Regional Director, sir.
Region 11.
Region 11.
Yes, but we're talking of all these regions, not just Region 11. We're talking of the entire country. We cannot have every region explain their policy. What is the national policy, Secretary?
That's why nga, Mr. Chairman, we just want to ask the Secretary what the policy is, because in some regions, apparently from the regional office direct to the private hospitals, kaya mabilis ang proseso. Pero meron po mga regions, apparently, na pinapadaan pa, and you can confirm or deny this, but the people from the Private Hospital Association are saying na dumadaan pa sila sa LGU, kaya dumadaan sa butas ng karayom, kasi kailangan pa daw ng, of course, the LGU will have to come up with the board resolution, whether it's the provincial board or the city board. So,
Yes.
to us, tama ba yan?
Mr. Chairman?
Can we just have the Secretary clarify? What is the policy? Should DOH funding for private hospitals go through the LGUs or not?
No, Mr. Chairman, no. Have to go straight to the private hospitals, Mr. Chairman.
Okay, so if that's the case, then you have to check with your field offices, because there are reports that some areas, the DOH downloads it first to the LGU or requires the LGU's participation when the funds are allocated for private hospitals. I think that is the simple action that should be taken, and therefore maybe a directive be made to ensure that all private hospitals need not go through local government memorandum of agreements when it comes to funding private hospitals with respect to the special risk allowance. Tama po ba yon, Secretary?
Tama po kayo. Tama po kayo. At malinaw po yung aming policy dyan. They don't need to go through the LGU. Diretso. Wala namang katuturan yung pagdadaan mo pa sa LGU.
Kung maaari, and with the permission of the majority leader, perhaps he can turn over the letter of the president of the Private Hospitals Association so that maliwanag, kwentas claras. Kasi ni-report na eh.
Yes, sir. Yes,
na lang ng Office of the Secretary.
Immediately to the committee and to the Secretary, Mr. Chairman, as well as just to add to what the Regional Director of the DOH Region 4, sabi niya sa Calabarzon, wala daw silang problema. I just want to put on record, a doctor friend of mine texted me last night and says, without naming names anymore who it is, I'm a practicing doctor here at Tanawan City, Batangas. We operate a small 45-bed capacity level in the city, sir. I presently stand as medical director. We have, just for the record, Mr. Senator, we have not received a single special allowance from local government or DOH po, sir. All the best to you and your family. Please, I hope you can help us with this. So yan. Kaya nga, ang gulo, he said, she said eh. Diba? Nasa news na sila, umiiyak na sila. Ano ba talaga ang totoo? Can we get the, we will have another hearing. We will get to the bottom of this. If they want sworn statements from this hospital, let's produce sworn statements. And obviously, there is an inefficiency of the delivery of these allowances. There must be something wrong in the process. Imagine the president of the Private Hospital Association complaining na dadaan pa ng LGU. Ibig sabihin talaga yan ang proseso sa ibang hospital na siguro hindi alam ni Secretary. Diba? So, Mr. Secretary, maybe you can look into this. And in the next hearing, we can come up with a clarity on the situation. Maybe that's the reason.
Thank you, Mr. Chairman.
Mr. Chairman, Mr. Secretary, maybe that's the reason for the delay. It's not your fault, Secretary, but maybe because of this so many due process. Diba? I'm the author of the Ease of Doing Business. Because of all of these layers and layers, kang kawawa yung mga nurses. Talagang kawawa po sila. Abot ng buwan bago dumating sa kanila. So thank you, Mr. Secretary.
Thank you, Majority Leader. We will now recognize Senator Marcos, who has been waiting quite some time. Unless she's willing to yield to our other colleagues who might be raising points on the issues earlier raised. I will. Go ahead, Senator Marcos.
Thank you, Mr. Chair. I wanted to wind up this subject matter because what's most alarming financially is the fact that this unobligated amount of 11.89 billion is not only nationally funded, inutang pa natin yan. A big part of that is constituted by foreign loans. So perhaps what we need to do para tahakin natin yung way forward, alamin natin ano ba talaga ang mga amounts na yan. Because there's a laundry list provided in the executive summary of the COA report, as well as random listings from DOH from the special risk allowance and then the hiring, pero meron pang PPE, magulo siya, may ventilator, may mga HFEP, halo-halo, masalimuot. Can we request, in as much as there's going to be another hearing in any case, that we get a proper listing and a breakdown of the composition of said funds and also the status presently. Kasi hindi matatapos ang usapin nito. May utang tayo sa lahat ng health workers, katakot-takot. So yun nga, i-meeting na yung mga health workers kung magkano talaga ang ine-expect nila at gawing maliwanag at transparent yung proseso. At sa kabila nun, alamin nga natin dun sa 11.89 billion na flinag ng COA, magkano pa ba talaga ang natitira? Para alam nila na may pera naman. Huwag na natin sagutin na kulang yung pera, magulo yung proseso, nade-delay. Hindi ba pwedeng tapusin na natin yung usapin na yan, hingin sa DOH at sa DBM, magkano yung perang natitira dyan sa mga unobligated na funds na yan, and at the same time, magkano ba talaga ang kiniklaim ng ating mga hospital at health workers?
Okay,
Mr. Chair.
with that manifestation, we are asking the Secretary of Health.
Mr. Chairman, we will comply.
Just let me complete so that the breakdown of the 11.85 billion is submitted, and we will be requesting that that be answered in the next hearing that will be conducted together with the DBM. So the DBM and the DOH will confer prior to the next hearing and submit to the committee. We are requesting them to submit to the committee the breakdown of this 11.85 billion as earlier manifested by Senator Marcos.
We will comply, Your Honor. We will comply, Your Honor.
Okay, thank you. Thank you, Senator Ontiveros and then Senator Villanueva.
Thank you, Mr. Chair. Just to add my voice to that question previously posed by Sen. Aimee, no, ano ba talaga yung current status ng close to 12 billion pesos na yan appropriated for the special risk allowance at saka hazard pay ng ating mga health workers? Kaya pa ba itong i-obligate or hintayin pa ba natin ang budget season uli? And there's a particular urgency to this question, common question sa atin na Mr. Chair dito sa committee ito, because nababalitaan natin na out of desperation, no, yung kanilang desperate situation, may napipinto tayong mga kababayang healthcare workers who have not received what is due them, na nasa bingit na ng pagbibitiw or kaya lockout or parang pagwewelga simply because they're almost at their wits end. Kahit dito po sa chat group, Mr. Chair, napaka-poignant na mga ine-express nila, halimbawa yung sobrang distorted na ang buhay nila bilang healthcare workers, pati yung usapin ng work-life balance. Kaya particularly urgent, Mr. Chair, malinaw sa atin ng DBM at DOH ang status ng halos 12 billion na iyan at kung posibleng ma-mobilize yan in timely fashion as in ngayon para simulang i-meet yung obligations ng national government sa ating health workers, healthcare workers. Baka para sa ilan sa kanila, that might spell the difference between taking that last desperate step or being able to survive at mag-survive ang kanilang mga pamilya a little more, Mr. Chair. Salamat po.
Yes, hihirit lang ako kay Senator Risa. Just like our chairman, Angara of Finance, I'm of the belief that said amounts can be made available for use throughout 2021 and as long as the pandemic persists. Habang may emergency, pwedeng gamitin at i-access yan. Hindi totoo na naglalaps lahat at wala nang gagamitin pagkatapos ng June 30. Palagay ko, tuloy-tuloy yan. Kasi hindi naman rini-rescind o rini-revoke ni Presidente ang status ng emergency.
Thank you, thank you. We now yield the floor. The chair, Senator Gordon is back. Thank you, Mr. Chair.
Mr. Chair.
Thank you, Brad Kiko. Thank you very much. And thank you, Aimee. That was a very good suggestion. If I understand you correctly, dapat ka tuloy-tuloy na itong law na ito para hindi na tayo pabalik-balik. Kung kinakapos, tuloy-tuloy na dahil ayaw natin nabibitin yung mga tao, di ba? Dapat meron tayong revolving fund. We'll see what we can do about the aid in legislation.
To ask my questions, ha?
Go ahead, Aimee. Go ahead, Senator Aimee. Go ahead, please.
Joel yata. Okay lang. All right. Well, it's still about the special risk allowance.
Yes.
Yeah. Last hirit na lang.
I'm supposed to be next after Lisa, but it's okay.
Okay.
I can give way.
Sige, go ahead, Joel.
Don't worry, Joel. You are a gentleman of the purest and highest order. You'll get your time right away. Thank you.
I will wait.
Michael Jordan din.
I'm your Scottie Pippen, Mr. Jordan. Please, Madam.
Yes, Joel, go ahead, please.
Oh, I'll go ahead. Okay. Mr. Chair, just to point out, as I have been mentioning earlier, I agree with our colleagues. Senator Angara, Senator Aimee made mention about this. Our chair made mention about this, that we are still in an emergency situation. And so that we will be able to do something and use these funds for our SRA, Mr. Chair. However, I would like to also point out, as we have heard from DBM, we have heard from DOH about the timeline. For instance, DOH made mention that the request was made April 8th, Mr. Chairman. Bayanihan 2 again was passed September 11, 2020, but the timeline shows from the DOH that the request only came in at April 8th. with the time of denial of the request on May 5, the request was made and released only by the end of June. Yun ho yung binanggit. But having said that, babanggitin ko lang din po yung kaninang issue na ni-raise ni Robert tungkol po doon sa meals, transportation, and accommodation. There were reports po kasi that funds intended for the meals, transportation, and accommodation of health workers were repurposed and returned to the Quick Response Fund. These are the yung gamit yata ito for test kits, etc. No? So gusto ko lang malaman, Mr. Chair, how much was the amount repurposed and where was it spent? Can the DOH, the department, provide a breakdown also of the repurposing of these funds para mas maliwanagan po tayo? Hindi naman kailangan ngayon, Mr. Chair, but at the proper time, okay lang din po. Salamat po, Mr. Chairman. Thank you, Ma'am Ivy.
Mr. Chairman, we will prepare the breakdown as instructed. We will do that, Mr. Chairman.
Thank you.
Thank you, Secretary.
I just have one question, Mr. Secretary. There's an item here that says 275 million operating unit distribution of meals allowances in the form of cash allowances, gift certificates, and grocery items. Bakit may gift certificates? Kaya lang ako nakarinig niya na, ba't kailangan may gift certificate? Hindi ko alam kung paano pumasok yung gift certificate. Usually, binibigay yan pagka kinakasal yung mga inaanak ni Joel. Di ba?
Baka parang coupon. Grocery coupon.
Ang pera kailangan ng tao. Bakit gift certificate ay bibigay? I don't understand that, please.
Mr. Chairman, can I request that USEC Vega responds to the question?
Thank you, Mr. Chairman, Senator Gordon, and the members of the Senate. Yes, very true that the COA actually observed that the operating units distribution of meals benefits in the form of cash allowances, gift certificates, and grocery items, and these were all unauthorized. The main reason for this, sir, is the bill only, or the DOH circular together with the DBM, only allows meal provision, and many of the hospital chiefs and the different implementing agencies, operating units, interpreted this as meals provision, meaning they can give vouchers, grocery items, and even cash allowances. So there were, I think, 814 million disallowances because this was interpreted by COA that this is only for meal provision. So we decided to, we talked with the COA, and they suggested to us that we write the Office of the President and talk to the President if this meal provision can be cash equivalent benefits to the workers. And so this was, OP actually listened to us and provided this form of benefits to cover cash equivalents and not just meal provision. That's the other, Your Honor.
Kind of weird that you're going to give checks at the time of pandemic. Parang frivolous yung term, no? Sa akin frivolous, saka parang hindi bagay, no? But sino nakatanggap ng cash gift na yan, ng gift check na yan?
Operating units of the Department of Health, sir, the hospitals.
Yeah, but that's a very nebulous term. Yung bang chief ng hospital nakatanggap ng cash gift, ng gift check?
No, sir.
Nakatanggap ka ng gift check, obligated na, tapos na, nagastos na yun. Hindi, wala ka na yung papaliwanag kung pinayagan yan. Madaling magbulsa ng gift ng pera pagka ganyan. Hindi naman ako nagsususpesya. Tumataas lang ang kilay ko dahil bakit magbibigay tayo ng gift check at this time at parang palusot.
Yeah, yes, sir. This is the allocated funds given to the operating units, mostly hospitals, for the meal provision, but they had a very liberal way of interpreting meal provision to even involve gift items, grocery items, and or the equivalent. So this was the issue that was seen by COA, and this is the reason why we asked OP to make sure that the interpretation in the operating units also be cash equivalent, so that the healthcare workers would benefit.
Well, I really don't quite agree with the term gift check in the middle of a pandemic. Right away, it will raise questions because while it is a very novel way of spending the money quickly, still you must give us a list of the people who got gift checks and what they did with it, di ba? At kung natanggap ba yung gift checks na yun, saan pupunta yun? Iba in the form of cash or in the form of magsha-shopping sila sa restaurants, makakainom sila sa Starbucks o ibang ginagawa nun?
Mr. Chair, Robert po, from
Yes,
HW.
Sir Robert Mendoza, yes.
Okay. Mr. Chair, kasi nung unang nilabas po ng Department of Health itong memorandum na ito ay may kanya-kanyang interpretasyon ng mga director doon sa pagkain na ito, sa meal allowance na ito. Kaya other directors, dahil sinasabi naman ng Department Order na quality meals in accordance with the nutritional guidelines for Filipinos. Kasi nung ibinigay po itong budget na ito ay late na po, December 15, at nagsasabi na dapat makonsume mo ang budget talaga dito is 38,000 pinaka-maximum per health worker. Sinasabi ng order na ubusin mo ito, yung 38,000 hanggang December 30. Imagine, December 15 lumabas ang budget, pinapakaubos ng December 30. So, paano mo ubusin yung 38,000 na budget per health worker kung gano'n ang nangyari? So, ang ginawa ng interpretasyon ng ibang mga director ay through gift check, vouchers, pero nakabatay lang sa groceries, sa mga pagkain ng mga health workers. Pero ang sana namin nito, dapat ibigay na siya, kausap namin si Senator Ralph Recto, si Senator Angara, ibigay ito ng cash kasi parang napagsilbihan na ito ng mga health workers, parang retroactive na lang ito, ibigay ng cash kasi mas alam ng mga health workers kung ano yung gusto nilang bilhin. So, noong June 1, dahil sa kausap natin ng Department of Health, nag-request na dapat ibigay na lang ito ng cash equivalents. At pinayagan naman ng Malacanang na through cash equivalents. That's why yung mga GOCC na nandyan pa yung kanilang mga pera na obligated, ibinigay ito as cash doon sa mga health workers.
You agree with it? The gift check, you agree with it?
Dahil ibinigay ito ng gift check at equivalent naman sa pambili rin ng ng grocery items sa merong MOA with the Pure Gold with other malls. So naibili po ito nila. Pero yung iba lang problema dito, Mr. Chair, yung ibang hospital na binigyan ng budget ay pinabalik ng Department of Health kasi gagamitin daw nila ito sa iba pang pangangailangan ng COVID response. Like for example, Jose Reyes, nagbigay ng 56 million, binalik ang 56 million. Ang Fabella, binalik ang kanilang 59 million. Ang problema lang, nung naglabas ng Malacanang ng cash equivalents, kinukuha na sana namin yung ibinalik. So, hindi na maibalik ng iba kasi nagamit na daw po pambili ng vaccine, pambayad sa mga health workers. Ang ibinigay na lang, almost 30% na lang, ang ibinalik sa mga hospital. Kaya yung 38,000 na budget per health workers ay nabawasan na siya. So, ang hinahanap ngayon ng mga nasa NCR at mga DOH hospital, asa na yung 70% kasi 30% lang ang ibinalik nila, saan napunta yung accommodation at saka transportation. Yun lang naman ang hinahanap ng mga health workers sa ngayon. At the same time, yung sana mabigyan pa rin sila ng budget for January to June na meal, accommodation, and transportation. Kasi habang may pandemya pa ngayon at dapat may bigay pa rin sa kanila. Yung active hazard duty pay, kasabay po yan ng SRA. Ang problema lang, sabi ng Department of Health, nag-request sila for active hazard duty pay, pero hindi nag-release ng budget ang ating DBM. Kaya naglabas ng order ang DOH, ginawa na lang nila based on savings na ng mga hospital yung active hazard duty pay. Paano kung wala kang savings sa hospital, paano makakakuha yung mga health workers? That's why yung ibang health workers sa kasalukuyan, wala silang active hazard duty pay na natanggap. Yun lang po, Your Honor.
Before I go to another question, I will just ask, at the rate we're going, this is just to find out, are you happy with the answers of DOH? Yan ang tatanungin ko sa inyo. Are you happy with it?
Kaya nga, Mr. Chair, hihingi na lang ako ng information. I-submit na lang nila kung di masagot sa ngayon.
Nangako na sila, isasubmit nila yun. Pero yung mga nakarinig na sagot, do you think it's cogent? Do you think it is credible? Yan ang gusto ko matanong sa mga nurses.
At saka kulang-kulang yung sagot.
Pwede po ako magsalita. Jao Plumia po sa presidente po ng St. Luke's Medical Center Employees Association.
Yes, go ahead, Mr. Klumia.
Thank you, Mr. Chair. In additional po doon sa sinasabi ni Pangulong Robert Mendoza ng HW, ang alam ko po kasi, pagkakalam po namin, mayroong 53.48 billion allocated for the healthcare workers na budget po ito na dapat ibigay. Ang sinasabi nga po ni Secretary Duque kanina, kulang nga daw po yung pondo. Bakit nagbalik pa po kayo ng 18 billion sa DBM? So ano po yung sinasabi din po ni Yosek Vega, ang sinasabi po niya na kami sa mga private health workers, merong natanggap, yun nga po yung sinasabi ni Director Balboa, ang nakakatanggap lang po yung Novaliches General Hospital, yung Chinese General Hospital at saka Philippine Red Cross. So kami po dito sa yung 10 ospital dito sa NCR, hindi po kami na nakakatanggap po nung sinasabi po na yung meals, accommodation and transportation allowance. So yun po, pagiging klaro po tayo kasi kung hanggat pa ulit-ulit niyo po yun sasabihin sa amin, hindi po namin yung tatanggapin dahil wala nga po kaming natanggap ni kahit 5 duling. Maraming salamat po, Mr. Chair.
Sir, Maylin po ulit. Maylin Beltran po, sir. Can I just directly respond po, Mr. Chair, to Jao? We have also met, sir, yes, we were able to provide global St. Luke's Global City around 19 million po for SRA. And then for Quezon City, we were able to provide 18.8 million po through our regional director po. Regional office, CHD Metro Manila po. For the record lang, sir.
Okay, for the record yun, ang tanong ko kay Mr. Clonia, natanggap pa ninyo yun? Kasi sinasabi, pag umabot ba sa regional director, sigurado na kayo umabot na sa St. Luke's? Maylin? Ayoko yung sagot na yun Ang sagot ni Secretary Duque, binigay ko doon sa regional director, bahala na si Batman. Hindi niya sinabing bahala na si Batman. Yun ang dating sa akin. Umabot ba yung pera doon sa pagbibigyan ng pera? Yun ang tinatanong ko. Umabot ba sa St. Luke's?
Yes, sir. Again, this was given directly to St. Luke's, again through the Center for Health Development, Metro Manila, sir. So,
do you agree?
Again, sir, again, I would like to manifest also that, of course, yung provision directly to the healthcare worker is already care of the management of the hospital. For example, here, sir, St. Luke's management should, well, of course, should have given their people their corresponding SRA po. Thank you, sir.
Ano sagot mo doon? Mukhang babalik nyo sa St. Luke's. Magpapaliwanag sa inyo yung management ng St. Luke's. Roldan, ano sagot mo doon? Roldan,
ito po yung sinasabi, lagi po kayo nakadiin doon sa SRA. Sinasabi ko nga po, may natanggap naman po yung mga nurses. Ang sinasabi ko po dito, paulit-ulit po tayo nag-uusap, Director Balboa, ASEC Kakarating. Ilang beses na po tayo nag-uusap. Ang sinasabi po namin, nasaan po yung ayuda sa amin para doon sa MAT? Lagi nyo pong dinadala doon sa SRA. Hindi po yun ang doon po tinutukan namin. Actually, nasagot na po yung kanina, sabi nga po ni Senador Gordon, dapat po mabigay na sa lahat kasi piling-pili po yung mga binibigyan nyo ng SRA. Maraming salamat po. Additional pala, hindi po kayo nakikipag-usap hanggang sa ngayon sa management kung paano po ang requirements para doon sa MAT. Maraming salamat po.
Sino management ng St. Luke's?
Yes, sa 10 ospital po, Mr. Chair. Ito po yung mga ospital. Cardinal Santos, St. Luke's QC, St. Luke's GC, yung Chinese General Hospital, Medical City, Infant Jesus, ganun po. Yan po yung mga, yung 10 ano po.
Hindi ba pwedeng ma-confirm yun mismo, Roldan? Tatanungin nyo, nabigay ba sa inyo? Ba't di nyo binibigay sa amin yung MAT? Meal allowance?
Nakausap na po namin ng aming management, Your Honor. So, hindi po ako magsasalita dito dahil baka malibel po ako, takot po ako sa ganyan, mahirap na po akong tao. Kaya po, lahat po ng sinasabi ko po dito, kanina po nanumpa ako at yan po ay paninindigan ko po lahat ng aking sinasabi. Maraming salamat po.
Sinasabi hindi umaabot sa inyo yung binigay sa St. Luke's.
Ito po yung MAT, hindi wala po talagang natatanggap ang dalawang St. Luke's po.
Okay, then it is up to the government to make sure that you ask, because talo naman palagi yung laborer pagkausap na yung big management, yung big company, dapat kayo ang magproteksyon sa labor. Ang sinasabi lang, hindi lang natanggap, sulatan nyo ang St. Luke's at sabihin nyo, sinasabi dito, hindi sila nakatanggap. Anong ginawa nyo sa pera? Tama ba yan, Secretary Duque?
Mr. Chair, very quickly.
Tama po kayo.
Yun, dapat sulatan nyo ang St. Luke's na sinasabi ng mga manggagawa, hindi nila natanggap. Siyempre, pag sila magtatanong, baka maipit pa sila sa trabaho. So, that gawin nyo yun. Yes, Senator Pangilinan.
My understanding with Director Balboa is that they are not, they admit that the meal allowances have not been given to these private hospitals, or at least a big chunk of it. But what they're saying is the special risk allowance has been given. At ina-acknowledge naman yan ng St. Luke's na natanggap yung special risk allowance. Yung hindi natanggap ay yung meal allowance. So si Director Balboa admits to giving, saying and acknowledging na binigay yung SRP pero yung MAT hindi na ibigay. Tama po ba yun, Director Balboa? Yung MAT hindi na ibigay? Kasi nga nagkulang na yung pondo o nag-expire na.
Okay. Sir, can I respond? Okay. Sir, yung sa MAT po, meals accommodation and transportation, yung na-release lang po sa amin na pondo is 10 million. And it is for 3 private hospitals and 4 LGU hospitals. So yun po yung aming ni-release.
Sa makatwid, hindi kayo nabigyan ng sapat na pera. Bakit hindi nyo ilista yan para isabit nyo sa amin? At bakit hindi sinusunod ng gobyerno yung inutos ng Kongreso? Gloria?
Sir, yes, can I answer?
May I defer kay
Gloria, you're the one who made the statement.
Mylene.
Yes, sir. Si Maylene po ito, sir. Sir, totoo po na wala pa hong naibibigay sa St. Luke's Medical Center. Ang nauna ho kasing nabigyan, na gaya ng sinabi ho ni Director Balboa, are those few hospitals na nag-request ho agad-agad. So yun ho ang pinunduhan ho natin ng 10 million. Because sir, for all the meal allowances, we were only given again 215 million pesos po.
That is not an excuse to me.
Okay,
Funds
sir.
allocated by Congress and DBM must enforce the law. So you are part of the executive arm and you say there is a statutory obligation, kailangan sundin natin yan, kundi napapahiya kayo, naiipit ang DOH, nasisisi kayong lahat, at pero ang may kasalanan, ang DBM, kulang ang binibigay sa inyo. Tumpak ba yun? Sagot.
Tama po. Tama po, sir. We request for this
Kompletuhin mo yung sentence. Ayoko yung tama po. Tama po, hindi kami nabibigyan ng DBP.
Sir, tama po na nagre-request ho kami ng higher amount and then DBM is also giving us an amount lower than what we requested po.
Yeah, so that means DBM, Madam Secretary, Madam OIC, Madam Acting Secretary, anong sagot po doon?
Eh, kung kulang ho yun, ba't sila nagbabalik?
Oy, magandang sagot yun. Oh, yan.
They had, just for the record, Your Honor, they had 1.6 billion for 2020, which is still with them, and they have not utilized it. They have not requested for authority to use that for whatever purpose. It's with them.
Yan, lumaki na sunog ngayon. O nasa inyo pala yung pera. Una, ba't kayo nagbabalik? Tapos hindi nyo ginagamit yung natirang pera sa inyo. Anong sagot? Secretary Duque.
We will look into it.
Can we have Director Wen Laura to answer the question?
Senator Pangilinan, you can never be Secretary Duque. Go ahead, answer please.
Good afternoon, Mr. Chair. So, I would like to clarify regarding po dito sa meals allowance po na ito.
Who is speaking?
Sorry po, sir. This is OIC Director Rowena Laura of Finance Service po ng Central Office.
No, wait a minute. I'm not asking a question. I want Secretary Duque to answer that. Meron na kayong 100 plus million. Nagsauli pa kayo ng 18 billion at tayo. Bakit sinasauli nyo? So, dapat mabayaran niya. Kaya hindi nabayaran, nagsauli pa kayo.
To clarify, sir.
Who's going to clarify? Is that the voice of Secretary Duque? That's the voice of a woman.
Yes, Mr. Chairman, I will have to look into this. I have to be honest that these figures that is being mentioned, I will have to go over the notes. But we will get back to you on this, Mr. Chairman. My apologies.
Mr. Secretary, I have been in the government also, and I know how it works. And it's a question of assertion. Anybody who works with me knows that the big A word with Dick Gordon is assertion, not arousal. All right? This country wants to arouse everybody, nagagalit, pinag-aaway-away. Ang kailangan natin, you're the secretary, you were given a budget, dapat kunin mo, assert it, because ang nangyayari, nababawasan ang credibility ni President Duterte. Dahil pinangako yan, hindi nabibigay, that makes you look irresponsible, that makes you look negligent, that makes you look inefficient, that makes you look like somebody who doesn't care about the plight of the people who are working, risking their lives, yung mga ating mga empleyadong pangkalusugan. You cannot fault that logic.
We will, as I've said, Mr. Senator, I'll look into this right now. Give me just a few minutes, and I'll get back to this, Your Honor. Just a few minutes. Look into it right now.
You know, there is a well-settled Supreme Court and bank case, Arroyo versus Aquino III. All right, and it says allotments which authorize an agency to enter into obligations are issued by the DBM. Allotments are lesser in scope than appropriations, in that the latter embrace the general legislative authority to spend allotments may be released in two forms, through a comprehensive agency budget matrix, ABM, or individually by SARO. Armed with either the ABM or the SARO, ang bilis-bilis ng SARO, natatandaan ko sa Dengvaxia, wala naman nakalagay dun sa yung listahan ng mga babakunahan na release. Kung gusto, maraming paraan. Agencies become authorized to incur obligations on behalf of the government in order to implement their program, activity, and project PAPS. Obligations may be incurred in various ways, like hiring of personnel, entering into a contract for the supply of goods and services, and using utilities. So, very, very clear is the rule na pag may pera, kailangan gastusin yan at sundan natin para hindi magagalit ang tao. Hindi ako aalis dito na nakabitin yung mga nurse. Kawawa naman sila na nakabitin. Kaya tayo nag-meeting. Don't waste our time. Kailangan magkaroon tayo ng closure dito. Hindi ba Acting Secretary, OIC, and Future Secretary of DBM? Tama po ba yan, ma'am?
Yes, sir.
You sound like a very responsible public official, and I'm very impressed, quite frankly. I hope that is not a case of first impression turned sour, but that to me is the government, the business of government is to make it work. If it doesn't work, then the people will get
Ano ba yan? Naggulo na yung utak ko. Hindi ko na alam kung.
Marami kayong psychiatrist dyan sa DOH. Pagamot ka muna sa psychiatrist sa DOH. Meron kami dito mga psychosocial support dito. I know it's very stressful to work in the government. So please make sure that you get it done. You know, I consider you a friend, but I have to be, my loyalty is to my country first because my loyalty to my friend. It's called accountability. It's a significant phase of the budget cycle because it ensures that the government funds have been effectively and efficiently utilized to achieve the state's socio-economic goals. Yan. Diba? An agency's accountability may be examined and evaluated through performance targets and outcomes. Ayan. Walang outcome. Hindi na gastos yung pera. Hindi na pakain. Hindi na bigay yung meal allowance. Moral goes down. And then, magagalit ang tao. And then later on, baka magwelga pa, hindi natin gusto magwelga. Ayoko yan, I will not encourage it. Budget accountability reports, review of agency performance, audit conducted by the Commission on Audit. Yan ang mga dumadating na paraan. So kailangan ayusin natin yan. We are willing to help, but you have to help yourself. God helps those who help themselves. Yes, Commission on Audit, Commissioner Chairman. Are you raising your hand, Mike?
Hindi po.
Sorry. Na-fake mo ko doon
Po ng Secretary General po ng Alliance of Health Workers. Sir.
Go ahead.
Mr. Chair, medyo mahaba na po yung ating pag-uusapan at nararating ay nasa 2,000 po mahigit ang mga health workers na sumusubaybay po sa atin sa araw na ito. At clarification lang po, ang sinasabi po nila, base po sa napag-uusapan natin, ay mababayaran po ba raw yung mga kakulangan ng mga benefits na hindi pa naibigay sa ating mga health workers at kailan po nila ito maaasahan? Marami po salamat, Mr. Chair.
Ang sagot ko dyan, mababayaran yan kung gustong bayaran ng gobyerno. Anong sagot ng Department of Budget and Management? Anong sagot ng Department of Health? Please answer. Hello?
Mr. Chairman, yun lang kanina kung pwede lang po. I am told yung sinasabi ng DBM na binalik namin na 1.6 billion. Hindi namin makita. We would like to sit down with DBM to reconcile because we couldn't see this 1.6 billion. So please give us a chance to sit down with the DBM and find out what this 1.6 billion is. We need to characterize this particular fund, Mr. Chairman. So we will sit down and reconcile with DBM right away, Mr. Chairman.
Thank you. Unutilized raw yun, Pinkoy. 1.6 billion unutilized. Is that correct, Secretary? Ang DBM? Tina?
She's on mute po.
Tina, paano nyo? Kando, no? Kando? Kanda, palitan na natin. Can do.
Sir, yung 1.6 billion, sir, remains unobligated for 2020. And it's in the financial report submitted by DOH.
Yeah, only 1.8 billion was obligated with a balance of 1.6. I think Tina and I are looking at the same thing.
Yes, sir.
Yes, pala naman, Secretary Duque.
Can we look at the SARO, Mr. Chairman? Can we be given the SARO?
3.4 in total for the procurement of ventilators, X-rays, and PPEs. Secretary naman, may kopya ako, kayo pa.
Ang lutong nung sabi ni Senator Marcos, ang lutong.
Gutom kasi.
Hindi kami natutuwa na napupundi na kami sa totoo lang. Pwede ba sagutin mo yan?
Mr. Chairman, capital outlay pala yan eh. Yan ang pinag-usapan, capital outlay. Kung mga equipment, hindi naman pwede natin na basta-basta hugutan yan.
Pero kung hindi nagamit, pwede i-realign, di ba? So long as it's within the same department, right?
Correct, sir.
Di ba?
Correct.
Siyempre, kaya
Same
pa.
is within the same department, you can realign it, sir.
Yes, we will. I'm sure that we have asked I will talk to my finance people to see if there was a letter of request for realignment. Normally, they do it that way.
Normally, it's the secretary who will ask for realignment, not your finance director.
Yeah, I sign it.
Kailangan kayo yun. Kayo yun.
Yes,
I really want to have the government succeed. I'm not an enemy of the state or the government. Pero kailangan mag-succeed tayo dito because ang daming namamatay. Kailangan magamit natin lahat ng pera. Inukol natin yan. Lalo na sa mga legislative, sa mga health workers natin. We owe it to them.
Yes, sir. We agree. We share with you that sentiment. Thank you.
Agreeing with me and not paying them are two different things. So you have to pay them. Kaya ako kaya ko sagutin. It must be paid because it's appropriated, approved, dapat bayaran. So find a way. At the next hearing, when we call the next hearing, I hope that you will be ready. And I'm putting a note here, not just a mental note. I'm putting a written note to make sure that when we hold the next hearing, it will be there. And I don't intend to call the next hearing on September 1 as my staff is suggesting it. We will do it even before we start on August the 25.
Yes, Your Honor. We will prepare.
Please do. I do not want to leave this meeting
Mr. Chairman.
workers. Ayoko yan eh. Ayoko yan. Hindi ko trabaho yan. Pagka tinrabaho natin, dapat tapos. Malinis. Okay po?
Mr. Chairman, there's just a bit of a clarification.
Sir, bumalik ho ako, si Maylin Beltran ho ulit. Sir, let me
Unahin
just
ko muna yung secretary mo. Secretary ko, speak up.
Yes, sir. Ako po si Maylin po ulit. Sir,
Ang bagong secretary, naghihingi ng permission Secretary Duque.
Mr. Chairman, may I respectfully request that you recognize ASEC Beltran?
Okay, all right. Sabi mo eh. Sige, Secretary, Assistant Secretary Beltran, alias Secretary Duque. Go ahead.
Yes, sir. Thank you po. Maraming salamat po. Sir, let me just take this opportunity to correct what I said on the targeted number of healthcare workers earlier. Kasi na-quote ko ho wrongly si Congresswoman Kimbo. So the correct figure is, for the record po, 526,000 healthcare workers ang initial estimate po namin. For the record.
Di ba yan ang sinabi mo? Sinabi ko, yan ang base figure, di ba?
Yes, sir. Pero iba ho yung na-quote kong figure po, sir. So the correct figure po is 526,000 po. For the record po.
I am just an ordinary mortal. Only God can forgive you, but I will forgive you.
Thank you po.
You're welcome. I have a few more questions before we adjourn, unless Senator Amy is raising her hand.
Yes,
I
Mr.
cannot
Chair,
refuse a lovely woman. Go ahead, Secretary Amy.
Thank you very much, Mr. Chair. Since we haven't had much luck trying to derive information regarding the special risk or hazard allowances or even the meal allowances, perhaps we can go to another subject, which is the largest amount cited by COA. And that is the
Excuse me lang, Amy. I don't think we need luck. I think we have gotten a lot already from them. And that's why when they come back, they will have to verify that. I am not going to allow luck to intervene. We are going to use our skill to get it out. Go ahead, please.
There we go. Perhaps we will require that for an even bigger sum. We're only discussing the 11.89 billion, not all of it being
Wala pa tayo doon sa ibang malalaki. Go ahead.
do with healthcare workers. Abala ako dito sa 42.4 billion, which is the fund transfer that COA cited for lacking documentary requirements and being unliquidated in the balances. An amount of 42.4 billion in total was transferred by DOH to DBM PS. Is that not correct? When did this occur and for what purpose? Was this a single tranche? Perhaps the DOH or DBM could answer.
Can I, Mr. Chairman, initially give my rejoinder? The 42.4 billion, out of this, 41.4 billion was downloaded to the PS-DBM, and the COA has flagged that this was done in the absence of a memorandum of agreement. Our
Yes,
rejoinder,
I understand the explanation. I would just like to know what happened to the missing 1 billion? You seem to have different figures from the COA, Mr. Secretary.
well, our figure is a total of 42.4, broken down as follows: 41.4 billion.
Yung 41.
41.4. Yes, sir.
Malaki-laki po yung butal kasi 42.4 ang sa COA. Yung unang sabi ninyo, 41.4. Mali po ba ang aking pagdinig? Talaga 42.4.
There are three items. I was going to break it down, Your Honor. The second one is 659 million, and then the third one is 288 million. So the total. Walang pangalan, oh.
Hindi, ano po yan, meron pong letter siya.
Yes. Mr. Secretary, may I ask also, and perhaps the USEC Tina can also confirm, may I inquire, why did DOH transfer this to DBMPS? The explanation I've heard in the media that you provided was that big ticket items are given to the purchasing agent of the government, which is DBMPS, or alternatively, DTI-PITC. Is that correct?
Mr. Chair, may I respond to the question of Senator Marcos?
Yes, please.
Yeah. DOH transferred these amounts, ma'am, last year because at that time it was the height of the pandemic, and the majority of the employees, I would assume, of DOH was from work from home, and they were also busy with the pandemic. So at that point, they thought it more practical and practicable to transfer the fund to PS-DBM. But the flag of the COA that there is no MOA is, I think, a little bit parang stricto naman, ma'am, yung interpretation kasi hindi po kailangan ng MOA para sa mga common use equipment.
Correct.
Hindi po i-transfer yan ng DOH at any given
Wala
time.
pa ako dun sa MOA, please. Ang itatanong ko lang, kung big ticket item at masyadong busy yung DOH, hindi ba sunod-sunod na procurement last year ang ginawa nila? Na nasa 6.8 billion, nagkaroon rin ng bidding para sa 4 billion. Nakailang bidding yan para sa face mask at PPE. Laging dinadaing yan sa amin dito sa Senate. Kasi syempre yung mga losing bidder na lokal, galit at hindi sila nakakuha. Bakit yun? Kinayanan ng DOH. Bakit ito? Napaka-espesyal, napakalaki, kailangan bigay sa DBMPS. Kaya naman nila halos buwan-buwan may bidding dyan What are the parameters of bidding within the department versus spinning out the funds to DBMPS? Mr. Secretary, are there guidelines for this? Is there a ceiling amount, for example?
Mr. Chairman, may I request that Director Paul Gimbarda of the Procurement Supply Service to please give his rejoinder. Thank you, Mr. Chairman. Director Paul Gimbarda.
Granted. Please hurry up and answer.
No, Mr. Chair, kasi ang pagkaalam ko, pag tinotal mo naman yung mga pinapabid ng DOH, di hamak na mas malaki na sa 41 billion. Bakit biglang hindi nila kayang gawin to?
Yes. Good afternoon to all the honorable members of the House of the Senate and to all present in this hearing. This is Attorney Paul Gimbarda po, responding for the DOH. So the first question was why the legal basis on the procurement of the DOH with the PS-DBM. The procurement was conducted by the DOH in accordance with the Public Act 9184 or the Government Procurement Reform Act.
It was negotiated. That's not correct, Attorney. With all due respect, the record states that these were negotiated.
Yes, madam. And then doon po sa sinasabi po ng batas, madam.
Conducted according to procurement law? No, you availed of an exception.
Okay, yes, that's correct po. There is a letter of instruction that mandates all national government agencies to procure through common use supplies and equipment to the PS-DBM, Madam Senator.
Hindi,
This
gusto ko lang maintindihan. Bakit kung minsan kaya ninyong i-bid yung mga ventilator, PPE, mga kung ano-ano, nabibid naman ninyo. Bakit ito biglang-bigla, kinailangan pa dalhin sa DBMPS?
Apa. Ang pinakamagandang sagot po dyan, Madam Senator, is that there is a legal requirement that all government agencies must observe. No? If we're going to procure po yung CSEs natin, then we will need to exhaust muna to source this from the PS-DBM as mandated po by the Letter of Instruction number 755, which was signed by the former President Marcos.
Ko na rin yan. Alam ko rin yung common use. Pero bakit kung minsan, mas okay kaya ng DOH, bakit kung minsan ituturo ninyo yung DBMPS? Dahil ba private, puro private supply contracts ito?
Mandatory po kasi, Madam Senator, na dapat exhaust po muna natin yung sinasabing CSE list po, no? Kapag po yung bibilin po ng DOH is nasa listahan po ng CSE nasa listahan po ng PS-DBM, then we will have to procure to the said agency.
Very ordinary naman yung binili ninyo eh. Hindi naman talaga mawawala sa listahan ng face mask at face shield. Wala naman kayong binibili na very complicated, highly technical industrial equipment. Wala namang ganun eh. Face shield lang at face mask. Bakit naman kakailanganin na pupunta pa sa specialized agency?
Aside from the mandatory nature po ng letter of instruction, Madam Senator, also for the purpose po ng practicality po, no, since these items are readily available sa PS-DBM list sa kanila pong listahan sa kanilang website, kaya po nag-procure tayo since these items man po are within the technical specification required by the DOH.
Attorney Paul, sinasabi mo sa akin ang DOH kailanman hindi nag-procure ng face mask at ng face shield?
Meron po tayo mga procurement.
Babalik kayo sa DBMPS? O talagang napaka-importante at espesyal nitong mga kontratang to?
Yun po kasing requirement, ma'am, ng yung first observation po ng COA that MOA needs to be executed. That was already clarified by the PS-DBM legal, ma'am, na hindi po kailangan talaga ng MOA when a government agency is procuring through PS-DBM's
yes, pareho kami ni Yusek Tina eh. Yung mga MOA na yan, kung minsan required, kung minsan hindi required. Nagtatalo din dyan ng DBM at COA. Yan, tagal-tagal kong mga governor. Alam ko yan, nakakasakit.
Pero ma'am, gumawa pa ako ng due diligence, Madam Senator. I asked personally po yung ating PS-DBM legal, and they replied to me August 15 then, that was Sunday, and then informing me na talaga pong they will, as based on their policy po by the legal division of the PS-DBM, they do not require the execution of MOA, Madam Senator.
Boss, kailanman hindi ako nagtanong tungkol sa MOA. Gets na namin yan ni Yusek Tina. Hindi ako nagtatanong sa MOA. Tinatanong ko, bakit biglang pinalit ninyo at linagay bigla dito sa DBMPS? Ano ba dyan sa DBMPS? Para bang DTI din yan, na PITC, na kung ano-anong kababalaghan ang nangyayari? Dahil kasi, ang kababalaghan na sinasabi ko, ang binili ninyong face mask dyan sa DBMPS ay 27.22 pesos at nag-expire pa kasi hindi na maibigay. Pagkatapos nun, umabot ng 120 pesos ang kada face shield. Sobra naman yatang specialized itong DBMPS at itong re-require ninyo na napakamamahal. Sabihin na natin na very tight ang supply at that point. Pero saksakan na yata ng overpriced.
Okay, ma'am. So, based po dun sa pipigil po sa aking information, Madam Senator, is that the Central Office Bids and Award Committee po really tried their best to procure these items, no? Unfortunately, because of
they have on more than one occasion, on repeated rounds of awards and tender, they have bought many millions of face shields, billions of face masks. Boss, isa pa, itatanong ko, ayoko mag-take up ng time, late na po, mainit na ulo namin. Hindi ho ba negotiated bid to at kapag buy in bulk ang gobyerno, we have a right to discounts?
Okay, ito pong procurement natin through PS-DBM CSE list po, no? These are readily available in their catalog po. that the technical descriptions are there for the procuring
Nasabi mo
entities to.
din eh. Tinatanong ko yung overpriced eh.
So,
Alam ko na yung
nakalagay po.
Mr. Chairman, if I may be allowed, can the
Mr. Chairman,
Undersecretary can answer this. Undersecretary Carol Taino. She has
Senator
the
Dillon is recognized. Excuse me, Secretary. Senator Dillon is recognized. Go ahead, Senator Frank.
yes, just as a follow-up to Senator Imy's very valid questions, and I raised the matter of the overpriced face mask before, and I raised it again today. That's why the questions of Senator Imy must be answered. Firstly, is the overpriced face mask and face shields part of the 42 billion which was moved over to the to PS-DBM from the Department of Health?
Yes po.
That's first. Just answer me. Yes, Mr. Whatever you. Yes,
Yes,
BS.
po. Yes, Senator. Opo. So these are two different observations that was.
Can you remove your? Hindi kita po maintindihan. Pakialis yan. Oo.
So these are two different observations, Your Honor, that was noted by PSD by the COA, no. So regarding po doon sa overpriced procurement, this pertains to the 2.48 billion that was noted by the COA for the procurement made by the Central Office, no, Central Office Bids and Awards Committee. Well, to answer that, Your Honor, during the time of our procurement, the time, no, the SRPs for these items were not yet valid. So when we conducted the procurements for this PPEs, no, we were looking at the reasonable price that existing at that time, and because of the global demands and the shortage of this. We need to, since these items are really important to the DOH, we have no recourse but to avail those that's being offered by yes.
Sir, but if you look at the facts, it is so obvious that there was an overpriced. First, you purchased this mask at 27 pesos and 72 centavos per piece. And the face shields at 120 pesos per piece. Ang sinasabon niyo po kasi limited pa ang supply noon, kaya masyado mataas ang presyo. Ngunit noong nagkaroon na ng enough supply siguro, noong September 20, DOH released a memorandum providing suggested retail prices for these items. 2 to 4 pesos per piece of face mask and 26 pesos to 50 pesos per piece of face shield. If you compare this to your statement that mataas dahilan sa hindi pa bago pa lang nun, ang laki naman po ng diferensya. Ang laki ng overpricing. Sino ba po ang head ng PS-DBM noong panahon na yon? Hindi pa naman ikaw, hindi ba? Hindi pa kayo?
Sir, I'm with the procurement service po of
the... Who was the head of the PS at that time? PS.
Mr. Chair, I will answer.
Sino? Yes.
It was USEC Christopher Lloyd Lau.
Christopher Lau?
Lau. Yes.
Okay.
Yes,
is he still around? Is he still in PS-DBM?
No more, sir. He resigned, I think, 2 months ago. I'm not sure.
About June? He resigned about June? Why did he resign?
I am not aware, sir. I did not ask why he resigned.
Is there a lot of talk going around?
He wanted to be an ombudsman deputy.
Ombudsman, di ba? Ombudsman candidate.
No.
Ombudsman, deputy ombudsman candidate.
No. He tried, he applied, but he withdrew. Can you imagine? He applied as a deputy ombudsman.
Anyway.
But anyway, Yes. So was it Mr. Lau who managed to buy tawag ito, these face masks and face shields at a very suspicious price, very high. Again, I would repeat, for 2 to 4 pesos for the face mask, as contained in the memorandum of DOH itself, umabot ng magkano? 27.22 ang bili, but yet later on it was found out to be only at from 2 to 4 pesos. And for the face shield, the suggested retail price from the DOH itself was 26 pesos to 50 centavos per face shield. Ang bili mo ng PS-DBM ay 120 pesos. Hindi po ba nakakapagtaka ito? Sino po ang bumili nito?
Under po yan nung time po na yon, under Secretary Lau.
Secretary Lau.
Last year, I think it was last year. I think it was already the subject of a previous investigation. I'm not aware what actually happened last
Who conducted the investigation, ma'am?
I think it was also the subject of a Senate investigation, Your Honor. I'm not so
No,
sure.
no. Testing kits yun, tsaka laboratory equipment, but not the mask. Sorry for that.
Yes. Thank you, Francis. So he was investigated for some other overpricing.
Yes.
Yes, sir.
Iba pang kaso po.
Iba pang kaso. Marami bang kaso itong si Christopher Lau?
Ay, hindi ko po alam. We are not very close.
Bakit kayo tumatawa? You know, my colleagues found it funny when I asked the question if Mr. Lau had a lot of cases. But anyway, I'll have questions later, Mr. Chair. I just supported the questions of Senator Amy. I'll ask for the floor later for some other questions. Thank you, Mr. Chair.
A very quick intervention, Mr.
Senator Pangilinan, go ahead.
Thank you. The DBMPS, is there a board? Is this a board, or is it a agency with a existing board? Maybe clarify.
Mr. Chair, I'm not aware. I think it does not have a board. It's just an attached agency of the Department of Budget and Management. It does not depend on the national government for financial support. It functions like a government corporation, but it's not. It's not a private.
Does the Secretary of Budget have any role in the DBMPS management?
Yes, Your Honor. He actually has the hiring and firing authority over the procurement service.
Okay, so he resigns in June. Christopher Lau resigns also in June. Well, anyway, very interesting.
Yes. USEC?
Interesting. Just the preliminary questions on Mr. Lau. Mr. Chair, can you recognize Mr. Chair?
Of course, I can recognize you. Thank you. Frank, go ahead.
Mr. Chair, may I ask the DBM if it is true that these face masks and face shields were supplied by a company named Pharmaceutical Corporation?
I am not aware, Your Honor, if that is the company that supplied it. I just knew at that time that it was all from China, because we had everything on it. And if I recall, we actually questioned, the executive committee asked the question on whether the amounts for the face shields, face masks, and other PPE would be defensible, because some people from the private sector were saying that it's expensive. So that was the question I recall, na yun po yung tinanong namin noon kay Yusek Lau. And he said at that point na because there were limited items in the local market, the amounts that he presented were defensible. So I left it at that. I did not ask more questions, Your Honor. I wasn't really pardon the word, I wasn't interested in the procurement going
Yes,
on.
for purposes of further questions on this point, can Yusek Kanda provide the committee with the last known address of Mr. Lau so we can invite him, if necessary, to this hearing?
I will ask those who are close to him, Your Honor. I can definitely provide you.
Yes, please. Anyway, while we're on the subject, may we know from the chairman, Senator Gordon, if the Philippine Red Cross would also purchase face shields and face masks?
Yes, Your Honor. I'm astounded, quite frankly. 120 pesos for a face shield, Mr. Chairman, Mr. President, Mr. Frank, Mr. Senate President.
Yes.
You know, 120 pesos. We bought it at 15 pesos.
Can you repeat that, Mr. Senator?
We bought
In
the face shield
Philippine Red Cross,
15 pesos, sila 120 pesos.
and the government purchased it under the PS-DBM. The price was 120 pesos.
From what I heard from you, yes. And then I heard that the price of the face mask is 27.22 for the government.
That's for the face mask. How much did the PRC buy the same?
Pesos then, and it's lower now.
How much?
5 pesos namin binili at that time in the beginning, and it's now very low, lower now.
Nasa 2
About the
pesos.
same time, Mr. Chairman, about the same time as the DBMPS purchased their masks, about the same time.
We purchased ours from the very beginning, so it should have been very expensive, but we got it at a low rate.
1/5.
Yes, and
Mr.
following
Chair.
the leadership of my good friend, the Minority Floor Leader, I would like the secretary or the acting secretary of the budget to send us all the records of all the transactions involving this Mr. Lau. Lau ba yun? Lau?
Yes, Mr. Chair.
Yes.
Mr. Chair.
All the records so we can follow and pursue all the transactions so we can check kung tama yung ginagawa dyan.
Okay, sir.
Mr. Chair.
Thank you. Yes.
Process of
Rizal Antiveros,
deriving
Mr. Chair.
information.
Just a moment. I think Senator Marcos would like to finish her point. Go ahead.
Yes. No,
Senator Marcos.
since we're already going to be asking for information, if it's okay, and in deference to Senator Risa later on, may I just inquire if it is possible also to derive from DBMPS copies, perhaps, of the articles of incorporation, because I understand these companies, the Pharmaly Pharmacy as well as Philippine Blue Cross Biotech, were newly formed companies with no financial or medical track record. And we would like to know also, because the board or the directors do not seem to have any background either in the supply area. Kung pwedeng mabigay ni Yusek Tina yung record itong mga kumpanya, kasi hindi lang naman ito ang pinanalunan nila, kundi iba't iba pang mga kontrata.
I would assume, Mr. Chair, I would like to answer.
Yes. Yusek Kanda, can you supply Senator Gordon, the committee, with all the documents?
I would assume that we have documents with our procurement service, because when they go into bidding, they do have, they retain copies.
Thank you very much, ma'am. I will reserve my questions then until we examine the documents.
Yes, Your Honor.
Sorry, Senator Risa?
It's all right. Mr. Chair, may I? Mr. Chair, naka-mute po kayo.
Secretary Antiveros is recognized.
Thank you, Mr. Chair. Thank you, Sen. Amy, and for promoting me as a secretary, Mr. Chair. Salamat po. Just particular to the point kanina, nabanggit po ni Acting Secretary Kanda in relation to former Yusek Lau. I do remember that time na merong mga pinrocure na karamihan mga China-made at lahat overpriced na PPEs, despite the fact, at ito po under the watch then of Yusek Lau sa PS-DBM, despite the fact na meron pong mga Filipino manufacturers ng quality PPEs, pasado sa quality standards ng DOH. Ito po yung mga CPMP, Confederation of Philippine Manufacturers of PPEs, at saka CONWEP, I forget the whole name. Pero nagreklamo sila na on the request of government itself, ni-retrofit nila yung kanilang garments industries in order to produce medical grade PPEs. At di hamak na hindi lang competitive pero mas mababa yung price nila. And they could not for the life of them understand bakit yung PS-DBM under the new SEC law instead procured more expensive and some subpar, sub-quality, mostly China-made PPEs rather than from them. So just to refresh our memory on that, Mr. Chair, habang pinag-uusapan itong mga misteryoso or hindi maintindihang mga procurement. So in addition to the masks and the face shields, pati nga po PPEs. And these have been subject of previous resolutions of ours in the Senate, Mr. Chair. Hindi pa lang lahat nadidinig pa. Salamat, Mr. Chair.
Yes, that's right. Laging dinadaing ng ating local exporters that they could have generated upwards of 25,000 jobs and thousands and thousands of surgical USDA grade face masks, of which none of these were hospital approved. In any case, I would just like to round off with the question to perhaps you, Sectina. May sinasabi na pagkatapos i-download ng DOH yung pera nila, kasi pera ng DOH yan, di ba? Ibabagsak sa DBMPS yung 42.4. Pagkatapos, ang dinadahilan nila dun sa COA report, hindi daw nila mabenta. They were unable to sell the masks and the shields to DOH, to the LGUs, and to the hospitals. Is that the procedure? Ibebenta pa? Pera naman nila. Parang nalito yata ako doon. Yun kasi ang explanation sa COA report.
Madam, Mr. Chair, I would like to answer. The DOH does not have the mandate to sell. There are certain government agencies that has that mandate, but DOH does not have the mandate to sell.
No, it's the other way around, right? DBMPS, having taken the money of DOH at 42.4, ibebenta yung face mask and face shield balik sa DOH. Ganun ba talaga?
Hindi po, Your Honor. Ang proseso po, ang TS ang procuring, ang head of the procuring entity ang pipirma po ng kontrata. So it's just the procedure, parang niche market yan ang ginagawa ng procurement service. So sila po ang nagpo-procure. Ang ultimate na signatory nito will be DOH, meaning they agree to the specs, they agree with the terms of reference, they agree with the price. So pagkatapos po nun, ibibigay sa DOH. Ang DOH hindi ho ibebenta nito sa local government units. Ang understanding po, this will be the requirements of the total health sector. So they will give it for free. And they will give it for free including to the private sector. Because at that point last year, there was a severe shortage. Hindi naman po inaasahan itong pandemyang ito.
Oo naman.
So, may pangangailangan yung face shield, face mask at PPE including yung buo, pati ulo at saka paa. Kasama po yun. Ibibigay po nilang free of charge yan. That is what is supposed to happen. Hindi po nila dapat ibenta yun.
Pero yung DBM, ibebenta daw sa DOH kasi daw ganun ang sinasabi ni, nandiyan pala, si Director Paul Gimbarda, yung kanina. Sabi niya sa House Committee kahapon yata to, tama ba yung pagka-report, na yung DOH ayaw daw bilhin sa DBMPS pagkat yung bulk procurement, overpriced na, delayed pa.
The rule actually is that agencies and departments are supposed to buy common use equipment from from PS-DBM.
Yes.
The event that PS does not have a stock of these items, the procurement service will issue a document saying that they cannot supply. And on that basis, the government agencies, ma'am, will procure it from other sources. The assumption here is the cost for the bulk purchases would make the items lower. No, mas mababa po ang presyo kasi bulk purchase. So, yun po yung rationale
ba yung narrative na naintindihan ko? They gave the money to DBMPS because they were too busy, in spite of the fact that they were actually awarding all kinds of contracts in the meantime. So they dumped it. And then at the end, when DBMPS had procured it, DOH refused to take it kasi yun ang sabi nila sa COA, kaya sila hindi makapag-liquidate, kaya hindi sila makapag-produce ng mga dokumento kasi ayaw daw nilang kunin sa DBMPS.
Pero hindi po nila pwedeng gawin yon dahil once they transfer the fund, that is considered obligated liquidated. So hindi po nila pwedeng at the last minute sasabihin nilang hindi nila tatanggapin. In the first place po, the DOH also signed was a party to the contract itself. Opo. Tama po kayo doon.
Baka naman may paliwanag ang DOH. Kanina, sino ba yun? Oo, yung nagpaliwanag.
Yusek Carol Tainyo, Mr. Chairman. Yusek Carol Tainyo, please be recognized, Mr. Chairman.
Yung procurement director, si Paul Gimbarda, yung nandito kanina, secretary, nandyan pa ba?
Yes,
kasi
yes,
siya
madam.
Di ba, kahapon? Ang sabi mo na itong common use nga, ayaw ninyong tanggapin. You are not willing to buy it back. Yun pang terminology. Nalito ako lalo pera naman ninyo yun. Bakit ninyo bibilhin back?
Yes, Madam Senator, no, parang I apologize, but I did not recall uttering the said statement yesterday during the lower house hearing po. As a matter of fact, I was only given I was only recognized by the secretary to respond on the needed execution of the MOA between PS-DBM and the DOH po, Madam Senator.
Okay,
So,
I think the secretary was pointing to someone else to reply regarding this failure to liquidate.
Yeah, this is Yusek Carol Tainyo, the head of the Procurement Supply Chain Management Office. Yusek Carol Tainyo, Mr. Chairman.
Nakamute po kayo.
Good afternoon, Mr. Chair. Good afternoon, Your Honors. Yeah. With regards po dun sa sinasabi na bumibili ang DOH, aside from what we have procured through PS-DBM, it's true that the PS-DBM do have a surplus of these PPEs in their virtual store. So they offered it to DOH if we can procure it. That is aside from what we have transfer.
Teka ma'am, teka muna. Sabi mo may oversupply sa bodega ng DBMPS, right? Oversupply. Tama? So,
yeah, that's what they're saying as ma'am.
May oversupply sa DBMPS.
So they offer it to us to procure.
Mag-expire na ba yung franchise ng
Pera ninyo ang pinambili nun. Ba't ninyo bibilhin ulit sa DBMPS?
Hindi po. According to PS-DBM,
buy it back. Pera naman ninyo ang pinambili nun.
Yeah. Two different po ngayon Meron kasi nag-request kami for them to procure for us, but ilang stock on hand sa kanila. So aside from the fund transfer na ibinigay natin sa kanila, they are offering their stocks po na bilhin namin. Kasi yung binigay po namin pera sa kanila, they also do the procurement for that
ang sinasabi ninyo, may namuhunan sa DBMPS, nagkapitalista, nagpasok na sangkatutak ng face mask at face shield galing sa China, at ngayon, pinapas sa inyo DOH? Yung ba ang sinasabi mo nangyari? Kasi bakit oversupply, punong-puno ang bodega, hindi pa nagkakabayaran?
Basta, I do not know, but we were informed that they have the stocks for us to, if we would like to buy it through their virtual store.
Why will you buy it? May 42.4 billion.
Yes, ma'am. Yes, ma'am. Yes, ma'am. That is over and above. Yeah, that is over and above the procurement that we transfer to them, but hindi po naman namin kinuha.
Mr. Chair, the mind boggles. May naintindihan po ba kayo, Senator Kiko, Senator Lisa?
This is a long and winding road leading to nowhere. It's confuse the enemy. With your permission, Senator Marcos, I'd like to ask a question, if I may. Secretary Acting Secretary. I really am beginning to be a fan of Yusek Tina Rose Marie. Do you have a person there by the name of Attorney Jason?
Wayan.
Uwayan?
Yes, Mr. Chair. He was recently appointed to replace Yusek Lau.
So is he in the is he in the this he's here right now, right?
Mr. Chair,
Show up.
Mr. Chair, may I please be recognized? I was raising my hand earlier, but it seems I was not seen.
In the first place, I don't think you were here when. Did you take your oath?
Not yet, Mr. Chair. That's why.
I recognize you. So I want to know, Director General Kimbo, can you administer the oath to this gentleman, Jason
Your
Umayan?
Honor. Yes, Your Honor.
PS,
Attorney Uwayan, kindly raise your right hand.
PS-DBM Director. Uwayan.
Wayan, sir. Wayan.
Uwayan.
Wayan. W-A-Y-A-N.
UAYAN po, sir.
Do you swear or affirm to tell the truth?
Oh,
Do you swear or affirm to tell the truth, the whole truth, and nothing but the truth in this hearing?
Yes.
Thank you. You may.
The answer is yes, sir.
Yes, Mr. Chair.
Thank you.
Yes, sir. Yes, sir.
Thank you. May I ask you a few questions? You have just been appointed, I understand, as the new procurement officer. Is that the title?
Designated, Mr. Chair, as the OIC, Executive Director.
Oh, I see. Yes. You know, I don't want to be funny, but I used to call OIC, O Ako Kita. All right. In the old days, I would kid the OICs before. Ang dami kasing OIC nung araw eh. May I ask if you're aware of the bidding on this face mask and this face shield?
Mr. Chair, there are two types kasi na nangyari sa PS eh. For Bayanihan 1, it was all under alternative mode of procurement, meaning negotiated.
Yes.
And for Bayanihan 2, it was under competitive bidding.
All right.
For
Isa negotiated, magkano ang presyo?
Negotiated, Mr. Chair, tama yung sa report po, Mr. Chair, na it was around 27 pesos po.
Yung face mask. Yung face shield, 122.
120, yes, Mr. Chair, based on our records.
Right. Doon sa competitive bidding, sino nanalo?
Sa competitive bidding conducted last December, for the face shield, if I'm not mistaken, Mr. Chair, it was Phil Pharma.
Phil Pharma. And the face mask?
For the surgical mask, there were 2 or 3 suppliers, Mr. Chair. One is all of which were imported articles, Mr. Chair. No local manufacturer was able to get an award for the bidding conducted last December.
So no, up to now you have no winner.
We have, Mr. Chair. In fact, it was already delivered, Mr. Chair.
Who delivered?
The surgical masks, Mr. Chair, were delivered by 3 different suppliers.
And who are they?
Hafid and Erasmus.
Erasmus?
Yes, Mr. Chair.
And then?
The JV of UDC Medtex Group.
UDC Medtech?
Medtex, Mr. Chair.
MEDTEC. Is that a Taiwanese company, if I'm not mistaken, or is that a company in the economic zone? Bataan?
That's the one, Mr. Chair.
Yes.
For the surgical mask.
Yes. And who is the other one?
Pero that was much later on, sorry, Mr. Chair. Yung pinanalunan ng MedTech was much later. Yung maaga, itong tinutukoy ng COA, mga never heard mga Blue Cross, Biotech, mga ganun eh.
Yeah, I'm going there. I'm going there. Thank you, Senator Amy. Dalawa na yung sinabi mo. Sino ba yung pangatlo?
Joint venture of Hafid Erasmus and another company also, Mr. Chair.
Do you have the name of that other company?
Pink Armor, if I'm not mistaken.
State
Pink Armor.
Pink Armor.
Yes, Mr. Chair.
Pink.
Joint venture.
As in pink as in the color pink.
Yes, Mr. Chair.
Like strong men wear pink. Ganun ba yun?
Ganun po, Mr. Chair.
Yes. All right. Now, what was the lowest bid?
Around 1 peso, Mr. Chair. More or
1
less.
peso for the face mask.
Yes, Mr. Chair.
And for the face shield?
For the face shield, it was around 42, Mr. Chair.
42. That's still higher than what we get in the Red Cross.
Pero it seems to be within the SRP stated by DOH, which was 21 to 50. Siguro yun ang sinusundan.
They be right. But di ba nagkagulo yan? Di ba abnormal na tatlong lowest bidder, bibigyan nyo tatlong bidder? O di ba nagkaroon ng cash sunduan?
That I do not know, Mr. Chair.
Hindi ba nakakapagtaka tatlo ang mananalo samantalang dapat yung lowest bidder lang?
Actually, Mr. Chair, it was composed of different lots.
Dinivide you into lots.
Yes, Mr. Chair. That's
Ang
why.
tawag dyan
Splitting.
Splitting?
No, Mr. Chair. Different delivery periods kasi yun, Mr. Chair, plus different places of delivery din.
Well, that is not a qualification. When you bid, you bid. You don't have to say where you're going to deliver. Basta economies of scale. If you buy a lot, normally you'll get a lower price, right? A lower bid. Correct?
Yes, Mr. Chair.
So, nakakapagtaka yung tatlong bidder ang nanalo.
Out of several bidders yung sumali, Mr. Chair, silang tatlo yung nakakuha
Hindi ba totoo na may nanalo talaga tapos nag-threaten magdemanda, inayos na lang siya? Para maging tatlo?
Yan, hindi ko po alam, Mr. Chair.
Naging God the Father, God the Son, God the Holy Ghost?
I do not know, Mr. Chair.
You don't ask. You didn't ask. It didn't pique your curiosity.
No, Mr. Chair. It was conducted under
Piques my
public.
curiosity. Ngayon lang ako nakarinig na nagpabid kayo tapos tatlo mananalo.
Mr. Chair.
Ikaw na ba ang nag-head ng bidding committee na?
Can you please rephrase, Mr. Chair?
Were you the head already of the purchasing service, DBM?
No, Mr. Chair.
Who was it? Lau.
Yes,
Lau.
Mr. Chair. Yusek Lau was the executive director at that time.
Right. Yeah. And when did he leave?
Sometime on June, Mr. Chair.
And do you know why he left?
I really do not know, Mr. Chair.
Mm-hmm. And where is he from originally?
I am not sure, Mr. Chair, but
you know.
From Davao.
Under oath.
From Davao, Mr. Chair.
From Davao. All right. Okay. I'm not suggesting anything. I'm just trying to test your credibility, whether you're telling the truth. Where are you from?
I'm also from Davao, Mr. Chair.
Right. Well, anyway, there was never mind. I'm not going to tell that story here because it's too embarrassing to tell that story. But certainly, I am wondering why this phenomenon that DOH cannot bid it themselves, and they're suddenly giving it to DBM. That's a recent vintage, isn't it?
Mr. Chair,
how long has that been going on?
The legal basis for that, Mr. Chair, first is that it is the mandate of the PS to procure common use supply and equipment to be sold to agencies of government.
Di ba may mandate yan, PITC?
No, Mr. Chair. It's actually for PS-DBM.
Yeah, PITC buys for the government. In fact, I was asking them, why don't you get supplier so we can learn how to make our own face masks. Have
It's
you ever considered that we should be able to, you know, the Japanese in World War II, they bought, in World War I, during the Meiji Restoration, they bought 4 ships from Britain, and then they made their own ships afterward, including the Yamato in 1936. Much better than the British ships. Ito, face mask lang, face shield lang, di pa tayo makagawa.
Mr. Chair, yung
Mr.
PITC,
Chair?
Yes?
yung original ng PITC po, limited noon to those countries with whom we had no diplomatic relations, such as China and Russia. So those were international purchases. And therefore, after that, yung mga imported,
India, from medicines.
oo. Tapos, itong DBMPS, eto na nga yung mga common use na sana pakyawan ng bili through DBM para makamura. Pero nakita naman natin, ibang nangyari.
Eh, hindi nga nakamura,
Mr.
nakagucci
Chair?
ang binibili.
Mr. Chair?
Yes, yes, Lisa. Senator Ontiveros?
Salamat. Yes, salamat Mr. Chair. Just as a point of interest, yung isang pangalan ng kumpanya na binanggit ni Yusek Uwayan kanina na nakapanalo ng bid for the masks is a familiar name, yung Erasmus. Because that was actually one of the Filipino PPE manufacturers na at least last year nabilihan ng gobyerno as proof na kaya ng local manufacturers to produce then PPEs and apparently now masks na up to health standards at competitive yung price or mababa yung price for that matter. Disclosure, Mr. Chair, hindi ko kilala ang Erasmus from Adam or Eve. Naalala ko lang sila dahil binanggit ni Yusek Uwayan that they were originally, Mr. Chair, akala ko Greek company. Apparently, it's a Filipino company. So, last year, nakapagpakitang gilas naman siya sa PPE. So, I remembered it nung binanggit as one of the mask
He wasn't Greek, he was
now.
Dutch.
Salamat, Mr. Chair.
He was Dutch of Rotterdam. I thought he was Greek. But anyway, nice name anyway. But I'm
Mr.
just wondering
Chair,
why
parang
it has really whetted my appetite to find out what's going on in DBM, that all of a sudden DBM, which is supposed to be the guardian of our budget, is suddenly buying. Di ba completely different purposes yun? You're supposed to give the budget and then you're going to buy?
na nga eh.
Yun na nga eh.
So, Mr. Chair, to close the loop, to finish the cycle of our confusion, yun nga, yung DBMPS ang bumili. So I'd like to get clarification on the original question earlier. Why is it that DOH was to buy from DBMPS when in fact the funds that were utilized to procure were DOH funds? And that was the reason that they gave to COA. Sana magpaliwanag na lang si Mrs. Carolina Taino at saka yung DOH, pati yung DBM sa pagkakaintindi nila dahil hindi talaga namin naintindihan.
All right.
So,
the chair instructs Ms. Kaimo?
Taino. Miss Taino.
I'm very careful with the way I pronounce it. Ms. Taimo. All right?
Taino, sir. Yes po. Good afternoon, Mr. Chair, Your Honors.
Yes.
I-submit mo na lang in writing kasi gabing-gabi na eh.
Yeah, I was going to instruct the chair.
Oh, that's right.
Writing.
Okay.
The position of DOH, why Carol Taino, you should give us a position why instead of DOH buying and learning how to buy things, you're passing it to another government agency that apparently, according to Senator Dillon, according to Senator Marcos, and according to myself, buys at astronomically high prices, and then all of a sudden, nawala na yung bumibili. Nagtangkapang pumasok sa ombudsman.
Yes.
Yes,
Diba? Yes, that's Senator Dillon. I guess
Yes, thank you very much, Mr. Chair. But I think the system of having this, the purchases of national government agencies coursed through offices like PS and PITC deserve a more serious and extensive study and investigation by your Committee on Good Governance. Why is that? Because number one, the agencies would make it appear that they have already obligated and disbursed the budgets assigned to them by passing on the budget to a procurement service such as PS-ADB, DBP, DBM, or PITC. Because I am sure that that they're doing this to get away from that situation where they have not executed their budget within time. So to them, the moment they pass it on to PS or to PITC, they have already obligated and disbursed the budget. When in fact, the funds sleep in these agencies for years. It would be interesting, Mr. Chairman. Later on, I'll ask the people for how much is parked in PS DBM. How
Today.
much is parked?
Today.
That's funds which are sleeping there for years.
Yes.
PITC or Philippine PTIC has about 35 billion, to my knowledge, parked in PITC, Philippine International Trading Corporation. I do not know how much is it in that's what I want to know. But having said that, Mr. Chairman, I think we're just scratching the surface.
Yes.
There's a lot of policy issues involved here. And, you know, insofar as the national agencies are concerned, and I'm sure Secretary Duque will confirm this, if there is so much in their budget, unobligated and disbursed, when the next budget cycle comes, DBM will tell them, Mr. Secretary, your Department of Health has not been disbursing the funds assigned to you, and therefore we will reduce your budget. So what is being done is to make it appear in the books, and this is not only for in the case of DOH, every agency does this, in order to make it appear that the funds are actually disbursed. This is passed on to a procurement agency like PS and like Philippine International Trading Corporation. It would be interesting, I would repeat, how much are parked there? Today, the Department of Finance is looking for funds. Mayroon pong nakatenga dyan sa mga ganyan. And it has been there for years. And under the law, they are supposed to refund that after the budget cycle is over. They're supposed to return that to the National Treasury. But since it cannot, insofar as the books of the national agency is concerned, they have already obligated and disbursed these amounts. Hindi na po reflection sa kanila yan, hindi na nakargo yan. So I would suggest strongly to the good chairman, part of our investigation on Mr. Lau's activities as head of the PS is to have a policy decision on the matter of these government funds being parked in the procurement services, both the ITC and the DBM, because I suspect billions of pesos are parked there. That's our submission, Mr. Chair.
Mr. Chair.
I agree with you very much. If I may continue, I agree with you very much, Senator Dillon. It is also a way upon which, as you say, they park the goods there. It's also a way upon which they can get more money next year, if you give it to me. Right? If you give it to DBM, you get more money. And happy na lang tayo kung sakasakali. Baka ganun na nangyayari. Di ba?
Hindi yun, Mr. Chair. Hindi ganun. Do you know that these funds are parked in government accounts, in banks? Because huge amounts of money, dinideposito po yan. magkano ang interest na kinikita yan? Saan pupunta ang interest? Because the interest is supposed to be public funds because the principal amount are government funds and therefore the interest earned is government funds. In some agencies, I think this is used for salary, for bonuses, for allowances. In other words, there is more to be looked at. There are many issues that must be looked at, and a policy must be crafted on this. As we said, Mr. Chair, maybe you did not realize it, but say on a 10 billion deposit in the bank, how much is the interest earned? And that interest earned is used for, remember, these are GOCCs. And therefore, they have boards that can determine how much are the bonuses. And where do you think the income comes from? There is no other income except the interest out of government deposits. So these are the things that we should look at, Mr. Chair. Thank you.
Those are very, very prescient observations, and we've discussed this before about PITC. You will recall, and we share this same suspicions, no? Although they're just suspicions. I just want to point out that baka naman alam nung bagong budget PS-DBM kung may mga park funds dyan.
Mismo.
Ano mo, sabihin mo na ngayon, meron ba?
Mr.
Chair,
Mr. Jason?
There are funds here at PS.
Marami.
I would have to check first, Mr. Chair, kasi we are in the process of complying with EO 87, which directs agencies under the executive department to revert to the Treasury 2017 and prior years funding. So we are currently collecting data on that and scheduling dialogue with the concerned agencies with respect to the reversion of funds to the Bureau of Treasury.
Will you then submit to us all these funds immediately?
Yes,
not on the day of the hearing, but as soon as you can. We're going to have another hearing.
Mr. Chair?
As soon as you
Yes,
can,
Mr.
maybe tomorrow or the day after tomorrow will be nice.
Mr. Chair?
Yes,
Yes.
Senator Kiko, go ahead.
Yes. When was that EO issued, Attorney Jason?
If I'm not mistaken, Mr. Chair, it was issued around 2019.
So you've been doing that for quite some time then. So maybe you have a ballpark figure of how much you have.
Mr. Chair, may I answer?
Yes? Oh, you said, yeah, Mr. Chair.
Yes, for purposes of transparency, the last time I looked, the amount that was available, reverted funds from government agencies amounted to 14 billion pesos for for procurement service. And in fact, we flagged this and told the BTR about this amount, and partially the amounts that we informed the BTR about was part of the financing for Bayanihan 2. I would assume that it is much higher, but there are claimants to the amounts that have been parked, meaning that there are still ongoing procurement processes, or these are balances of live SAROs which nag-generate po ng savings. So,
pareho lang ng PITC.
14 billion na ito po yung kumbaga you can consider this as parang mga no claimants or dead na to. Hindi man dead as in patay, as in accounts na hindi na humatrace. So yun po yung huli kong nakita, that was mga dormant accounts, yung mga 14 billion yan. It was used also to part of the finance Bayanihan 2.
14. 1-4.
Yes, sir. Yes, Your Honor.
Very
Mr.
good.
Chair?
Yes.
Release on Tiveros, Mr. Chair.
Give me some time to breathe and absorb what was just stated. 14 billion is a lot of money. Go ahead, Senator.
That's the reason why. That's the reason why.
Yes.
Senator Drilon is very correct that it used to be a parking. So that's why recently, or I think 2019 and earlier, the agencies were no longer required to provide cash, yung backup na cash, sir, and the PS would do the bidding without the cash backup, especially if the funds of PS could absorb. So, ibig sabihin, maliliit na transaction, relatively small transactions, pwede nang hindi magbigay ng cash backup. So, ibig sabihin, obligation lang ang i-cover, yung allotment lang ang ita-transfer sa PS.
Yes, but Mr. Chair, I think we should discuss this more in detail on another occasion because the PITC is a trading corporation and yet they are asked to procure fire trucks and construct fire buildings. Yeah, so really this is something that we should look at,
They
Mr.
also
Chair.
have news for you. DBM, sa procurement service, is also in the business of buying fire trucks.
Yeah, yes, but it's there. It's anyway. As we said,
Si Tina eh, oh. Si Carol.
I think we should look at this deeper, Mr. Chair.
Definitely. You can bet your bottom dollar or your bottom peso.
Mr.
Yes,
Chair, to round off our
Chair.
discussion po.
Senator Marcos, yes.
Yes, Mr. Chair, I would just like to make a final request for information para ma-round off na natin ang ating napakahabang hearing at sa ating napakasipag na chairman. All in all, pwede bang magtanong, as of 30 June 2021, nung naglaps ang Bayanihan 2 at sabihin na natin yung mga iba't ibang extension, considering all these findings of the COA, na may 67 billion dito, may 95 million na expired medicine, may unremitted hospital collections, ang dami-dami nito. How much is the total and remaining unobligated 2020 fund of DOH? Kasi naghahanap tayo, nagpapakapatay tayo maghanap ng pera para sa ating health workers, sa meal allowance, sa transport, sa kung ano-ano. Magkano pa ba talaga ang nandyan sa DOH? Kasi ang dami-dami nang nato-tot up. May remaining unobligated ng 2019 extended budget, meron GAA 2020, napakalaki ng 13 billion sa Bayanihan 1, nasa 9.1 billion ang natitira at binalik sa National Treasury sa Bayanihan 2. Ang laki-laki niyan, ba't hindi natin ipamigay sa ating mga health workers ng dali-dali? Ano bang inuupuan natin? So Mr. Chair, if we can request a real breakdown of the total and remaining unobligated so that we know how much money is actually burning in the pocket of DOH.
Mr. Chair, with the indulgence of Sen.
We will comply. We will submit.
So ordered. The request of Senator Marcos is ordered. In addition to that, I'd like to see who are the bidders and their backgrounds, their documentation, and who won the bids and their background and their capability. We can always get this from the SEC, of course, but we want to make sure that we can rely on the DBM to provide us with the proper information. Yes, Senator Risa.
Mr. Chair, salamat po. No, before Sen. Aimee would synthesize it, meron pa sana akong isang tanong dun sa yung fund transfers no na undocumented. Mr. Chair, is COA Chairman Mike Aguinaldo still around?
Is Chairman Aguinaldo still around? Please sound off, please.
Yes po.
Yes,
Thank you,
he's
Mr. Chair. Thank you, Chair Mike. I wanted to ask about these undocumented fund transfers. Hindi lamang sa DBM, hindi lamang sa DOH, pero sa COA. Because I feel like it's one of the most numerically significant and interesting points in the COA report which your commission drew our attention to dito sa Senado. Kanina kasi nung tinatanong ni Sen. Aimee, sabi ng DBM, kaya nangyayari yung ganung fund transfers dahil pandemic ngayon. Pero parang that's not naman completely acceptable as an explanation. Otherwise, baka yung buong gobyerno na lahat na lang ng mga department would engage in these fund transfers and park those funds. nung tinatanong din ni Sen Amy, sabi naman ng PS-DOH in answer to one of her questions na ang pinakamagandang sagot dyan ay, but we're not after just magandang sagot, but yung mas totoo at saka mas tama. So I'd like to ask the COA Chairman Mike, in your report, it stated that 42 billion pesos intended for the department's COVID-19 programs were transferred to procurement or implementing partner agencies absent the required memoranda of agreement and other supporting documents. Do you confirm this po, Chair Mike?
Yeah, I think that's found in the report.
Okay. Yes.
That's one of the issues that, of course, DOH is contesting whether
Yes.
MOA is in fact actually required.
Okay, which is actually the most interesting question for me. But before I get to that, can you specify what these programs were and what partner agencies they were transferred to? Or lahat ba sa PS-DBM lang? Or were there other agencies? And for what programs, supposedly?
As far as I can recall, I think about 41 out of the 42, more or less, about 41 billion, I think, was transferred to PS-DBM.
All right.
And I think maybe about 600 million might have been transferred to PITC.
So PITC, okay.
Meron rin po.
Meron din.
If I recall, this is really for PPEs and
PPEs.
related type of equipment supplies.
All right. Salamat po. DOH in their reply said that they were in the process of producing all the missing documentation. So have the MOAs or any other form of supporting documents for these finally surfaced or eventually surfaced?
As far as I know, wala pa because again, they're questioning whether a MOA is in fact required. No? So there's a bit of an issue there. Although I seem to recall an update, I think yung sa PITC, I think they either na-submit na or they were working on the MOA already. But sinabi naman namin yung this, they can still submit that pa naman eh. The basic issue po kasi sa amin is, when you transfer money, dapat may documentation. Ano yung ba't mo tina-transfer? And I think one of the important points that sometimes is missed out, the purpose of the MOA is not just to document the money transfer, but also to impose obligations on the entity on whom the money is being transferred. So for example, like, ano bang period of delivery nito? Ano yung mga conditions sa yung mga ganon. So I think that's really the purpose po.
So Chair, hindi po pwedeng tanggapin na dahilan na nakaligtaan lang yung MOA or anumang dokumento dahil sa urgency of the situation. Lalo na involving amounts of this magnitude na tens of billions of pesos.
Yeah, I mean, at the least, we expect that, at some, maybe not immediately because of the situation, but at some point, i-comply naman nila para lang klaro. Although, ideally, mas maganda talaga sa umpisa, but we understand naman the situation, nagmamadali, but pwede naman to follow. But yun nga, the problem is there's a point of contention on whether a MOA is really required.
Yun na nga po eh. But for one, I'm hoping na magko-comply ang DOH at yung PS-DBM at pati yung PITC pala within the 60-day period the Commission has given them. So second to the last, the most interesting question for me, Chairman Mike, is it legal for these transfers to take place? Is it legal for an agency to transfer funds to another entity without even a MOA between them as to how these funds will be used? At additionally, sabi nyo, in fact, to impose obligations on the receiving party?
It's a tough question. I think two parts. No, first, why would you transfer funds to another entity? The idea usually is because that other entity perhaps has greater expertise. They're more attuned to doing that. For example, we do have projects that are in the budget.
Oops, naghang yata si Chair Mike. Mr. Chair, okay.
Yeah.
Oops. Okay, now I think we can hear you again, Chair Mike.
Yeah, okay. Yeah, sorry, medyo naglalag
It's all right.
yung ano ko. Yeah, so normally you would transfer if there's a particular expertise or yung absorptive capability of the agency hindi nila kaya. So you could imagine, well, I think PS-DBM was set up primarily for common use supplies but also for other procurement needs, no? So if it's transferred to an entity that doesn't have any expertise or what, medyo mapapakamot ka ng ulo. And
Right, as in
legality
this
of that
case.
transfer might be it. The second aspect, of course, is it had become a tool to obligate allotments,
Yes.
no? Yung appropriations. Kasi pag na-transfer sa PS-DBM or PITC noon, parang considered obligated na. So it actually bought some of the agencies some time, no, to do that. But yun nga, it's an interesting issue because you do see that more often, and maybe one of the issues we should be looking at guidelines on, you know, kailan ba pwedeng i-transfer and all. That was one of the problems with you know, some of the other funding issues in the past, no? May mga fund transfers, and even for the auditors naging mahirap yon, you know, trying to track, na kanino na, pinasa namin ito, pinasa doon, and all that. So yun lang po.
Opo. Salamat, Chair Mike. And speaking lastly of tracking, so most importantly, have these funds been audited?
Since the funds have been transferred, we would have to check with the auditors of PS-DBM
and PITC
on the actual utilization. It wouldn't be the auditors of DOH. Yeah. So yeah, auditors of DBM and PIT.
I see. So we'll be maybe waiting for your findings on that sa commission, Mr. Chair. Salamat, Chair Mike. Maraming salamat, Mr. Chair.
Yeah,
Thank you very much, Senator. Senator Angara, I'm going to have some questions, but go ahead, please.
Just as a short request before you ask your questions, Mr. Chair, in relation to the points raised already during the questioning of Senator Marcos, for instance, regarding the details on the unobligated amounts, because I've been seeing figures as low as 11 billion and as high as 24 billion regarding unobligated funds. And so I'd like to address, Mr. Chair, a request to any or all of the following agencies: the DOH, the DBM, and the COA. I'd like to request the details of what are these budgetary items that have not been obligated, and an explanation for why they were not obligated, and if the intent is to obligate them at some point, or they have already reverted to the DBM. I don't really know. I'd like to know, Mr. President. And lastly, since going forward, we'd like to know, underspending has been a problem, I think, for many years now, and I think certain predecessors of Sectina or OIC Sectina were also saying it's no longer a problem, but apparently, if we look at the figures, ostensibly it still is a problem. So we'd like to address that going forward, Mr. President. What are the recommendations of these agencies, DOH, DBM, and COA, to address efficiency, Mr. President? Efficiency in spending. Yun po ang request natin, Mr. Chairman. Thank you.
Thank you, Senator Angara. The Director General Kimbo is requested and directed to make sure that the comments made by Senator Angara is communicated to the departments concerned, as well as other comments that he made that are relevant, including all the points made by the other senators concerning DBM PS, and as well as the invisible government that is apparently existing. You know, you have a government that's supposed to be buying things, and that they're creating an invisible hand, an invisible government that is actually undertaking what they should be doing as a way to escape, as a way to park money and not revert back to the treasury. And then here we go looking for money na kailangan natin para maibigay sa mga naghihikaw sa vaccine o yung mga tauhan natin na hindi mabigyan ng meal allowances. Around that point, so ordered. Now, with the permission of our colleagues, I'd like to ask a couple of questions. Number one, to DOH, would it not be possible for those who are supposed to be issuing these resources to our very valuable health services folks. Yung mga nurses natin, yung mga janitors, yung mga emergency folks natin katulad ng mga ambulance service, meron naman sila nasa payroll, di ba? Bakit hindi pa nyo idirekta yung pera doon sa mga tao na yan? Dahil doon naman sila sumusweldo, ipadala natin direktamente doon. Dahil I'm sure may mga computers kayo dyan sa DOH, di ba? Pwede ba yun? Who's going to answer that? Secretary Duque?
Mr. Chairman, I believe the DBM might be in the best position to answer.
No, but the money is with you. And therefore, di ba, bibigyan nyo ng yung mga hazard pay, para rin salary yan, dagdag sa salary. Di ba? 25% of the salary. 5% of the salary pagka ikaw ay lampas ng 19, no? So, ibig sabihin, you can actually, para sigurado nakukuha ng mga tao natin, yung kanilang binigay natin mga benefits of which they are so deserving. And so, can we do that, Mr. Secretary? Direct to the beneficiary.
Yes, that would be the best arrangement. But there's a policy question there, which I would like to request the DBM to address.
All right, Dr. Lady Tina, can you please answer the question?
Sir, I'm sorry, I do not see any policy issues with regards to a direct release to the recipient if they are part of the payroll. So there is no, I'm not aware if there is any policy issue in that question, sir.
I agree with you. In fact, I'm going to ask the nurses, would you be, and the health services, Mr. Sikwan, si Mr. Mendoza, ba't wala dito yung mga pangalan mo? Sila Maristela Benojar, sila Jocelyn Andamo. Would you prefer that the money go directly to your payroll account?
Yes, Mr. Chair, mas maganda po yun para direkta na po sa ano.
Oo, wala nang angalan, di ba?
Mr. Chair, gusto ko lang...
Walang pumasok sa account ko. Ayan, no? Natatrabaho ko dito, walang pumasok sa account ko.
Mr. Chair?
Yes.
Gusto ko lang susugan yung sinabi ni Senator Angara na sa ngayon po dahil nasa state of emergency pa tayo, dapat tuloy-tuloy rin po sana yung mga benefits na makukuha ng mga health workers sa kasalukuyan. Hanggang September po yata na-declare ng ating Pangulo na tayo nasa state of emergency.
Yeah, and it looks like it's going to extend. Today we had about 11,000 cases reported.
Yes po.
And the positivity rate is 23%. Baka kinakabahan ako, baka ma-extend na naman ito. Itong ating lockdown. So it's important that let me get back to my point. My point is, ang angal ng mga health workers natin hindi umaabot sa kanila. Kung padadaanin nyo nga naman sa St. Luke's Management, padadaanin nyo doon sa kabila, lahat yan ay may payroll services lahat yan eh. Padaanin nyo na doon dahil doon naman dumadaan sa payroll nila. Kukunin lang natin yung mga payroll accounts para tuloy-tuloy doon at malalaman natin yung pupuntahan ng pera. Is that okay with Ms. Maristela Benojar and Jocelyn? And let me ask now the PNA president, because she's been here and I've not been able to ask her a question. It would be a pity if she was not able to put her position in. The PNA and the Philippine Medical Association are here. Dr. Noemi Sarabia and Dr. Angelito Beca, and for the PNA, Governor Melbert B. Reyes. May I ask for your position on the entire hearing right now, as well as my proposal na kung pwede yun, if it's as possible, if it's more feasible na padala na direktamente sa inyong payroll account. Who will go first? The nurses first. If you're still there.
Actually, Mr. Chair.
Yes.
Sa Alliance of Health Workers kasi hindi lang nurses ang kasama namin po.
Healthcare workers, lahat yan. Kaya lang inimbita ko sila eh. Dapat marinig ko rin yung kanilang comments.
Okay po, salamat.
kung wala sila, di sila sumasagot, there'd be a record that I asked them, kaya dapat hindi umaalis eh. Pagka sinawaan nyo eh, talagang hihina ang loob namin na parang hindi rin kayo interesado. Di ba? So dapat pakita nyo na interesado kayo. There is another question I'd like to ask because speaking about computerizing this, Secretary Duque, ano ba yung mahiwaga sa computer nyo na nagkakahalaga ng 700,000 per computer? May finding kayong ganyan?
Yes, Mr. Chairman. Thank you, Mr. Chairman. The KMIT's director can elucidate on this. Director Eric Tayag, please be, may I ask that you recognize him. Director Tayag.
Eric, can you please hurry up? Speed is the name of the game. Secretary Duque, it seems you have a missing si Eric Tayag. I think I hope he's not dancing yet because he's a great dancer.
I'm here, Senator.
Hello, Eric. I know you're a great dancer. Baka iniwanan mo na kami. Sumasayaw ka na kagad.
Hindi po.
Ano sagot mo doon sa mahiwagang computer na 700,000 per computer, 4 na laptop?
Okay po. Ang latest update po yan.
Latest update,
Opo. Una po, kinancel na po namin yan sapagkat naghanap kami ng funds para sa kailangan po ng aming CHD, particularly dyan po sa Baguio General Hospital and Medical Center. Kasi kailangan po nila ng IT support. Pero bago po namin kinansila yan pong mga laptop pong yan ay gagamitin sana ng aming mga developers. Hindi naman po pwede, Mr. Chair, na yung ordinaryong laptop lamang po.
Anong ang klaseng computer yan?
Gagamitin po kasi ng programmers po namin.
Hindi nga, anong klaseng computer?
Ito po ay may kinalaman.
Eric, anong klaseng computer? Apple? Orange? Ha? Ayan,
Kasi
branded.
po,
Wala nga brand. Nakalagay lang, branded.
Opo, kasi specs lang ang nilalagay namin. Bawal po kami maglagay ng brand.
Oh, kaya nga, nakalagay branded. Okay. Ano ang klaseng computer yan? Ito nga, ibig sabihin ko sa akin, ano mga capability niyan? Ayan, oh.
Opo, may padadala po namin yung specs. Kung gusto pong malaman po ng inyong lupon po.
Apple, di ba pwede tayo ng Apple yan?
Hindi po. Specs lang po nilalagay po namin dyan. So, dahil sa hindi na po natuloy po yung negotiated procurement.
Sino ba ang nag-request niyan talaga? Sa totoo lang.
Opo.
Sino nag-request ng computer na yan na 700,000 ang halaga?
Yung opisina ko po kasi kailangan po namin kasi kami po yung gumagawa ng mga registry po. Halimbawa po yung bakuna registry, kailangan po naming mailagay po at ma-visualize para maparating po sa mga policy makers kung ano na po yung datos at kailangan na po sapagkat may analytics din po. So kailangan po namin talaga ng mas upgraded po na computer po. Kung hindi po kasi kung ordinary lang mabagal, inaantay po yung mga analytics. So yung nakikita nyo pong nire-report ng DOH, yung nasa website po namin, ay dahil lang po sa ang ginagamit naming computer ay hindi po yung ordinaryong computer, Mr. Chair.
Ano yun? Ano yung computer na yun? Yung pagka may magsasabi sa inyo, kagad nasasabihin siya, hindi lang si Siri? Babatukan ka pagka mali yung tanong mo? Ano ba yan?
Hindi naman po. For example po sa cellphone.
Yung ID processor nyo nakalagay dito, i5. I7 na ngayon eh. Di ba?
Opo, pero yun po yung
Windows
pinag-aralan
10,
ko ng technical team ko na yung i5 ay hindi naman kailangan pong i7 kasi limitado rin po kami sa budget po.
Padala nyo lang ako in writing bakit siyang computer na yan ang gumawa at sino nag-request. At para saan?
Mr. Chairman, if I may
Yes,
interject this issue, Senator Migs. Yes, sana mabigay niya sa amin yung sa atin na yun. Ano naman siya under oath. Ano po yung brand at yung model ng computer? Because we can always look online now to see if it really costs 700,000. I've never heard of a 700,000. I use a gaming computer, Mr. Chairman. This is a Predator. That's what I'm using right now. This is one of the fastest computers. It cost us 96,000, Mr. Chairman. So, and this is what I use for our Zoom sessions. And when I'm online in Cagayan de Oro, I'm still as majority floor leader doing the traffic in the Senate. So, baka nga, hindi naman ako magaling sa computer. Baka hindi ko alam anong model na yan. Sana maibigay po nila yung model number ng laptop na yan, Mr. Chairman.
Mr. Chair, wala pa po sapagkat hindi po natuloy yung procurement. Hindi namin alam kung ano po yung ibibigay na brand ng supplier po sapagkat ongoing pa po yung procurement at binalita ko nga po na kinancel namin kasi nga may naghanap kami po ng maiaalat dun sa mga nangangailangan po ng ICT support namin. So, hindi na po namin binili yan, bagkos ay isasama yan dun sa maibibigay po namin sa Baguio General Hospital and Medical Center.
So, for clarity, Mr. Chairman, hindi pa ito nabibili?
Hindi pa po. Hindi pa po nabibili. Thank you, Mr. Chair.
Eric, just some advice with the permission of Senator Zubiri.
Yung sa face.
Go ahead, Mix. I didn't know you were speaking. Go ahead. Senator Zubiri?
Could you hear me? Am I lagging?
I can hear you. Go ahead.
Me, Chairman?
Go ahead, Senator.
Yung sa face binanggit ni Senator Drilon, our minority floor leader, na 120 pesos. Anong klaseng face shields po yan, Mr. Tayag? Maybe get a response, Mr. Chairman, from Mr. Tayag. Kasi may binanggit po ang ating minority floor leader na 120 peso face shields.
122.
Alam naman po natin yung face shields ay hindi naman ganun kamahal, Mr. Chairman. If you're talking about buying 10 face shields, walang problema. But if you're talking about buying thousands of face shields, malaking problema po yun.
Kaya nga pinatawag natin na Senator Zubiri, yung nag-order niya, si Lau, yung nag-conduct ng bidding. At para malaman natin. At patawag natin.
Thank you, Mr. Chairman. Maybe we can be furnished, the committee can be furnished.
Yes, we'll do that. We'll do that.
Mr. Chair?
May I continue? I just want to finish this para matapos na, ano? I now would like to ask about PhilHealth. Marami nagko-complain sa akin. Pati kami nagko-complain sa Red Cross. Hindi na lang kami kubi-kubi, tinitiis na lang natin. Pero ang PhilHealth, maraming mga hospital, ang P-Happy, si Richard Lirio na andyan, PhilHealth, Dante Giran, andyan ka, kaibigan pa naman tayo, pero nagko-complain, hindi raw nababayaran yung inyong mga hospital. Like Makati Medical, like St. Luke's, umaabot na raw ng billion ang utang. Totoo ba yan, Attorney Giran?
Hello, good afternoon, sir. Mr. Chairman, good afternoon po.
Good afternoon.
Thank you. First of all, thank you for inviting us in this hearing today. And at least naman para makapagpaliwanag kami.
Of course. Yes, sir. Go ahead.
Okay. Pwede ba ako magkwento, Mr. Chair, bago ako sagutin?
Pwede ano?
Pwede magkwento? Pwede ako magkwento?
Pwede magkwento.
Opo.
Ano, sa kanya, once upon a time ba sasabihin mo? Or ano?
Related naman po, Mr. Chair.
Go ahead. Just go ahead and answer.
Okay. When I came in on September 17, 2021, as appointed President and Chief Executive Officer of PhilHealth, The PhilHealth at that time was bombarded with a lot of complaints because of alleged corruption, particularly in the investigation conducted by both houses, the lower house and of course the Senate, involving IRM, involving inflated attempt to purchase IT. And the investigation was so extensive. A lot of things were uncovered. So I came in. And when I came in, the first thing I did was reshuffling of men, officials from all regions 1 to BARM. And there was also, when I came also, there were suspension of this big time officers of Pasig office because of the investigation conducted by the Department of Justice, particularly its line agency. I really found myself in a place where it's not common for me, no. So I was talking to my people in the meetings, in all meetings, at the EXCOM meetings, and then my people at the core plan concepted this idea about the 3-point action plan. And this 3-point action plan was about the initial of my name, no? DEG, Dante Igueran. And the D stands for digital transformation. And the A stands for anti-fraud. And the G is basically about good governance. And so I had to what we call create an internal affairs task force, no? Because unless I have this one, I cannot start with investigating people, no. But again, the matters at hand is not technical for me. So I had to seek the what we call this, the assistance of the NBI, the AMLA, the ARTA, and the rest, no, including the PSA for those reported what we call this repetitive process of hemodialysis. Sinabi po nila na kahit na yung patay daw, dinadialysis pa rin. So kaya, ang ginawa natin po sa PSA, na nagkaroon tayo ng tinatawag na data sharing. At nakuha po natin po. And so, ayun na po, nakita ko po, Mr. Chair, na madaming problema sa loob, no? Problem about IT problem, because we have a fragmented IT, no? At least people are not fragmented. It's the infrastructure, the solutions and the right. And it's a very good thing that we have talented people at the PhilHealth, we have bright people at the PhilHealth. The only thing is they need a leader. So what makes the IT problem so problematic, because of all those agencies in the government, we are the greatest user, no, of data. You can just imagine 110 millions of them to be in our database, no, including your honor, sir. And we process something like 11 millions claims every year, and for 2021, at the rate we are going, we will be processing something like 14 millions. So an increase of something like 3 million a year. And you can just imagine that the IT infrastructure are still there, the same, and the people are the same, even decimated. But our claims are what we call this, our claims are ballooning. So I also made a good coordination with the office of the very good COA chairman, Chairman Mike Aguinaldo, thank you sir for your support sa aming DCPM. Na-release kagad ang DCPM natin, yung 60%. And so, all those things, sir, okay. The problem talaga, sir, is ito. Mali po yung sinatawag po na hindi kami nagbayad sa mga claims. Nagbayad po kami, Mr. Chair. Kaya lang po, mabagal po. Mabagal ang pagbayad.
Ante, the hour is getting late and I hate to stop you, but could you just submit to us kung sino pa ang hindi niya nababayaran at magkano?
Yes, Mr. Chair, opo.
Para mas mabilis, para sa next hearing, mas mabilis tayo at tatawagin natin sila para kung may problema. Kasi alam nyo, it goes back to the problem of the nurses. Kung hindi nyo mabayaran yung hospital, baka magtanggal ng mga nurse yan. O kaya bababa ang sweldo ng mga nurse. O kaya hindi nila maibibigay yung dapat ibigay sa mga nurse o sa mga doctors. Kaya napakahalaga niyan. Kailangan lang talaga malinaw natin yan. I investigated also PhilHealth and I know kung anong maraming mga nangyari dyan before your time and I hope you have stopped it already. But certainly, we cannot afford to have the government owe all these hospitals in the middle of a pandemic na hindi sila makakontinue mag-operate because magastos eh. To go to a hospital now, you really need to be insured or have a lot of money. And that is why it's so important na mabayaran sila on time. So I will ask you to present to us all the debts that are supposed to be pending and a day schedule upon which you could actually finish all these debts para all these liabilities para sa ganun that will be your legacy to PhilHealth. And also, we want to know kung sino talaga yung nabuwag yung mafia dyan, kung naandyan pa yung mga yan. Because you will recall, meron mga tao dyan nagbabayad dun sa isang hospital, I think sa Bukidnon or sa Davao ata, nagbabayad for a sickness involving liver, diabetes ketoacidosis. Ang bayad nila maabot ng millions pagkatapos doon sa UST. Iilan lang ang pasyente. Pero sila, nasa probinsya, ang laki-laki ng binayad. So, marami akong findings. Maybe, if you're interested, the Blue Ribbon can show it to you, no? Para matigil na nga yung mga nangyayari dyan sa katiwalian sa PhilHealth at mabayaran na natin yung mga hospital. That's all.
Thank you, Mr. Chair.
So will you do that, please, for the next one? And I'm glad and I congratulate you na one thing that is going for you now, I think, is you're now covering all the dialysis, di ba? Dati hanggang 90 treatments lang kayo. Ngayon, lahat na treatment ang binabayaran ng PhilHealth.
144 sessions po in 1 year, Mr. Chair. Para naman to extend the life of our people, those who are infected with kidney disease.
Yes. Thank you.
Thank you, Mr. Chair, Chairman, for bringing about the case of kid. I know that, Mr. Chairman, it's a hospital in Tagum, Davao del Norte, Mr. Chairman.
Yeah.
And as a matter of fact, with my coordination with NBI, my former employer, we had filed 3 cases against them. Noong unang pag-file po, Mr. Chair, doon sa provincial office, dismiss po. MR, dismiss again. Ako hindi pwede to. Hinapol ko sa DOH, sa PIPREV, petition for review. The case is now pending at the petition for review.
Congratulations. I wish we could make it faster para hindi matatakot sa mga yan if they get away with it. And what they do is they, in fact, even threaten the hospital. They better dance with them, otherwise their payments will be withheld. You are aware of that, right?
Yes, Mr. Chairman.
Yes. So congratulations and thank you very much for one. I just want to make sure na I say a few words in behalf of the hospitals na dapat talaga nahihirapan na rin sila, umaangal sila. All the hospital owners that I meet, they always complain that they have a large payable coming from PhilHealth. So if you can see your way clear into clearing that, that would make your legacy a lovely legacy for people to follow. Thank you.
Thank you po.
Very much. So if there are no other questions, I think Senator Taveras, you had one more question. If there are none, would the nurses and the health workers still have concerns? Because we will conduct another hearing. So yung hindi pa natin na tatalakay na concerns ninyo, hahabulin natin sa next hearing. But
Yeah.
quite frankly, I'd like that settled right away because I'm really very concerned, as we all are in the Senate, that our health workers are protected.
Mr. Chair?
Yes.
Mr. Chair.
Robert po, Mendoza.
Yes, Robert.
Mr. Chair, gusto ko lang pong i-note ngayong araw na ito na dapat yung mga hindi po na ibalik na 70% doon sa MAT kasi 30% lang ang ibinilik ng Department of Health. Dapat yung 70% maibalik pa rin siya doon sa mga hospitals para ma-enjoy pa rin ng ating mga health workers yung mga benefits na yun. Kasi as of today, marami pa rin ang kakulangan doon sa ating mga meals, accommodation, transportation sa mga hospital po.
Mr. Chair.
I'm sure I can speak for all the senators, especially the majority floor leader, who will fight for you, and the minority floor leader, who is the real majority floor leader. And we have this standing joke here, and all the other senators here, that we are able to see our way clear na mabayaran yan. That's practically a vested right.
Mr.
That
Chair,
is a statutory obligation.
Mr. Chair,
Statutory obligation, dapat bayaran ng gobyerno yan.
yeah, Mr. Chair,
Yes.
dagdag ko lang po kasi na-freeze yung hiring ngayon ng mga hospital ng mga nurses po dahil doon sa hindi pa ini-implement yung salary grade 16 ng mga nurses. Kaya ang ating understaffing talaga is malala na. So sana ang DBM po ay magkaroon na ng final decision para doon sa implementasyon ng nurse to bilang salary grade 16 kasi hindi ito sa ngayon naka-freeze ang mga hiring ng ating mga nurses in recruitment dahil hindi pa pinapatupad at wala magsagot ang DBM doon sa salary grade 16 na ito na nilabas noong June 1 ang executive order ng galing sa mga
Di ba na-settle na yan?
Hindi pa po.
I even wrote a letter about it. Sabi nila na-settle na yan.
Hindi pa po.
Ito yung sa salary grade 31, di ba? O 19 ba yun?
Salary grade 15 po.
15. Oh, yung umpisa.
Naglabas kasi ang executive order nung ang ating Pangulo noong June 1 na dapat ang para doon maiwasan na ang demoralization kasi ang nurse 1 at saka nurse 2 parehas sa kanilang salary grade. So ginawa na ng Malacanang na dapat ang nurse 2 ay nasa salary grade 16 na po. So noong June 1 hanggang ngayon hindi pa rin siya na-implement kaya naka-freeze yung hiring ng ating mga nurses kaya walang nagre-recruit or walang nag-admit or sa mga nag-apply dahil hindi sila makapag-hire ng mga nurses na bago dahil naka-freeze pa po yung hiring ng mga nurses na ito.
Secretary Tina Rose?
Ayan po.
Sir, I think that is not really my expertise. I would rather call Assistant Secretary Kim De Leon.
Is Kim De Leon there?
Yes, I think so, sir.
Asa Kim? Usong-uso yung Kim ngayon dahil sa Afghanistan. By Rudyard Kipling. Kim De Leon.
Wala ba?
Mr. Chair.
Yan.
Are you there?
Yes po of Philippine Nurses Association, I would like to add as a rejoinder of issues on salary grade 15. I'm sorry for my absence kanina po kasi may tinake akong call.
That's all right.
I would like po to raise the concern din po na because of the DBM circular, the infamous DBM circular 2020-4, marami po tayong nurses na demote because of that, and with the EO po hindi pa rin po yun na ibabalik, and we would like to ask help po to the good office of the senators to look into that kasi po wala pa po yatang plano ang local government unit na ibalik yung ating mga nurses doon sa kanilang mga original position.
No po, aside from that, with the issues po ng PhilHealth, Mr. Chair, marami pong nurses tayo, lalo na sa private hospitals, na pag nagkakaroon po sila ng symptoms, they have to submit themselves for a swab test on their own. Maglalabas po sila on their pocket, no? From their pocket, kasi po hindi na po daw kayang sagutin ng mga hospitals yung kanilang pampaswab because hindi raw po sila nababayaran ng PhilHealth. So if you can help our nurses po with this problem po, na sana mabayaran na sila ng PhilHealth para naman po masagot ng mga hospitals natin yung para dito sa mga swab test nila pag nagkakaroon sila ng symptoms, no? And to look into different issues na we gathered from our survey that we would love to send to your office po. Kasi po hindi kami nabigyan ng pagkakataon to raise it a while ago. Thank you po, Mr. Chair.
Honorable Chair, may I be recognized po?
Yes, go ahead.
Honorable Chair, rejoinder lang din po doon sa issue po ng upgrade ng salaries ng government nurses po. Kasi yung nurse 1 po, supposedly naging salary grade 50 na po sila. Marami pa pong nurse 1 sa government na hindi pa po na-upgrade. And then in relation to the memo po ng Office of the President through Executive Secretary Medialdea, supposedly po yung mga nurse 2 ay ma-upgrade na po sa salary grade 16. And then po, yung mga na-demote ng mga ranks na senior government nurses ay supposedly po ma-retain po sila sa kanilang mga ranks. So, we wrote a letter last July 16 po, Mr. Chair, sa office po ni Executive Secretary Medialdea. So, yun po sana ang ihihingi po sana namin ng tulong kung pwede ma-follow up po sana yung guidelines for the implementation po ng upgrade ng salary ng mga nurse to government nurses po from salary grade 15 to salary grade 16 po. At saka yung mga senior government nurses ay ma-retain po sa kanilang mga ranks kasi marami po sa kanila ang na-demote. And then yung mga nurse 1 po sana ay ma-upgrade na po yung salary nila from SG11 to SG15, lalo na po yung mga nasa local government unit. Salamat po, Mr. Chair.
Mr. Chair?
Just a moment. I'm looking at a release here by Donna Pasubigan, I think of the Inquirer, if I'm not mistaken. Nurses celebrate win versus demotion. And on June 7, 2021. And this is in Region 7, a memorandum by Executive Secretary. That's why I was under the impression na nanalo na kayo. Salvador Medialdea, dated June 1, reversed the DBM circular which raised the salary of entry-level nurses from salary grade 11, or about 22,000, to SG 15, or about 32,000 a month. Di ba okay yun?
Bali po, sir, may I be recognized again?
You don't have to ask. You're recognized.
Okay po. Sir, that was the June 1 issuance of the memo of the Office of the President signed by Executive Secretary Medialdea. But then, all the healthcare facilities are still awaiting for the guidelines from the either DBM or DOH. So they said that they cannot do anything yet, no actions yet on the ground because there's no guidelines yet. So what we did was to follow up through a letter. We sent a letter last July 16 to the Office of the Executive Secretary Medialdea, and we are hoping that you can help us follow up for the issuance of these guidelines.
We will communicate with Secretary Medialdea and find out what's going on because hindi na nga kayo nababayaran ng inyong mga pinangakong benefits. Pinago pa uli itong sistema ng ratings niyo, no? So we will try and do that. Does this DBM Secretary have any comment?
Mr. Chair, I think Asek Kim De Leon is around.
Yeah, I've been waiting for him with bated breath.
Sorry, Mr. Chair. I would just like to provide an update on the upgrading of the nurse positions, and I would like to update Mr. Chair that we have already received the clarification from the Office of the President last Monday, clarifying, among others, the effectivity date of the upgrading of the Nurse 2 positions from salary grade 15 to salary grade 16. We are now in the process of finalizing the budget circular for the purpose, but just to be sure that operationalizing the circular will be smooth on the part of the DOH, we'll also be scheduling by Monday at the very maximum, Mr. Chair, a consultation with the DOH before we finalize the circular for consideration of our officer in charge, Mr. Chair.
What did you say? A confrontation with DOH?
A consultation, Mr. Chair.
What are you going to confront them about?
We'll be consulting them on some operational concerns, Mr. Chair, on how they will affect the upgrading of the
So in other words, you agree with the nurses here right now that the DBM's position is to uphold their request. Is that correct?
Yes, Mr. Chair, because we have already received the approval of
Including
the
the most senior nurses, right? Na hindi na sila i-demote.
Yes, Mr. Chair. Among others, they will be the 7 position series of the nurse positions will be reinstated, Mr. Chair, and that the nurse 2 position will be upgraded from SG15 to SG16, Mr. Chair.
That's excellent. That's excellent news. So, ang kailangan na lang ay i-confront natin ngayon si Secretary Duque. And I will now confront Secretary Duque with that. Secretary Duque, are you still there? Secretary Duque?
This is Yusek Vega, Your Honor. Secretary Duque right now is taking in the bathroom in the break. Bathroom break, sir.
Oh, bathroom break. All right. Okay. I'm sure it's going to be quick and furious. All right. But anyway, what I'd like to know from you is, Mr. Yusek de Vega, is
Vega. Only Vega, sir. Yusek Vega, sir.
Yusek Vega is.
Yes, sir.
What are your thoughts on this? Do you think the secretary, waiting for him to complete his constitutional, to make sure that that the nurses are upheld?
Yes, sir. That's right. In fact, we even approached already the DBM with Secretary Bisado before, and he agreed that the salary grade would be for nurse 2 would be 16 and retain the other salary grades of all the nursing positions. So we were just hoping, waiting for DBM actually to clarify with OP, and I think ASEC Kim already informed us that the OP has already made the necessary clarification, and we will be coordinate by Monday, sir. I think we all agree to that, sir.
If you were a student in law school, you would have been given a 5 for not listening. Because ASEC Kim already said okay na sa kanila sa OP at saka sa DBM.
Yeah, right, sir.
All right. Now, sa inyo, okay na ba?
Okay, sir.
Okay na.
Okay, sir.
O, papapalakpakin ko na ba yung mga nurses na nandiyan ngayon?
Mr. Chair, clarification po.
Oh, may clarification pa.
Number 3 po from Philippine Nurses Association.
Yes.
Marami po kasi ang mga LGU na pagkatapos pong i-release ng DBM Circular 2020-4 ang nag-demote na po ng position ng nurses. Ngayon po ang tanong namin, with this development po ba, kasama po ba pag sa gagawin ng DBM, ng DOH?
Somebody please go on mute if you're talking because we'd like to hear what the gentleman is saying. So kailangan masabihan ang ng DBM at saka ng DOH, yung DILG, para sabihan nila status quo, yung original position na ginawa ng OPM, ng Office of the President and the DBM and the DOH is now the rule.
Mr. Chair, how about po those nurses na pinapirma ng panibagong kontrata? Like Nurse 2, pinapirma po sila ng Nurse 1 ng mga LGUs. We would like po to know kung i-reinstate po yung dati nalang position.
That is an appeal that must be made by you to the guidelines titingnan natin sa guidelines yan at dapat kung kailangan ipa-implement sabihin sa DBM at sa DILG. And
Mr. Chair, if I may.
The way I look at the proper secretary, the should-be secretary, Secretary Tina, I think she'll be good for it. And at the same time, alam ko naman, the little big man from DILG has got a big heart, and I think he will be able to make the DILG, everybody follows the DILG, the local governments, especially with the Mandanas ruling. They will have a lot of money coming from the Mandanas ruling. So I don't see that as a problem.
Mr. Chair, with the permission of our officer in charge, just to respond to the manifestation.
Who is speaking?
Kim De Leon po from DBM.
Kim, go ahead, Kim.
Mr. Chair, those are the scenarios that we would like to iron out in our consultation with the DOH, so that once we release the budget circular, we'll make sure that all the possible scenarios will be covered and that there will be a little to no room for error already for the implementation of that decision of the office.
May I ask you a favor? I don't want to impose myself on you, but I never leave something important which affects the lives of people simpering or hanging. I would advise you to do it by this coming week para matapos na ang problema. So our people who are suffering, our frontliners who are suffering, will be relieved and give them something to smile about and to say good things about our country for a change.
Definitely, Mr. Chair, will facilitate the immediate issuance of the circular.
Very good. As my professor in law, the late Justice Horado would say, definitely. Okay? All right? Pwede, walang dipindi. Okay? Thank you. Thank you very much. Kung may problema, sundan na lang natin sa DILG, but we will follow it up. I assure you, we'll be there to assist. Okay?
Chairman, thank you, Chairman. This is Migs.
Senator Simile, of course.
Yeah, I have to go. I have to log out
already. He will help, right, Migs?
I have to log out already, so I just wanted to ask Chairman, when will our next meeting be, so that we can prepare?
But before I tell you the next meeting, will you help these nurses fix it up?
Oh, absolutely, Mr. Chairman. I've been fighting for them since last Monday pa. Napasok na ako sa TV and radio interview. Galit na nga sa akin si Secretary Duque, pero mahal ko pa rin siya. Tinutulungan natin siya.
Talagang galing mo talaga.
Pero yung akin dyan, Mr. Chairman, when would the next meeting
the next meeting will be August the 25th at 10 a.m.
That's next week, next Tuesday. May I ask a favor, Mr. Chairman, if you can invite also members of the IATF so that we can discuss vaccines? Because I do not want to badger the good secretary, because I know they have it's a delegation of duties, and I believe when it comes to the vaccines, the IATF.
I'm also of the same thinking. I don't cast aspersions, and I don't categorize it on the basis of the noise created out there. As you can see, there's an explanation for everything, and therefore we will accommodate your request, and I hope that they will accommodate us ang IATF. Marami tayong dapat pag-usapan dyan, at it's always good to talk in an atmosphere where both of us listen and respect one another without insults. I mean, I don't like to see what happened in the House, na pati talaga naging emotional na yan si Secretary Duque, which I think is not good, and I think we're all Filipinos. We're not Taliban, so I think we should be able to settle the problem very, very quickly.
Absolutely. So yun lang, Chairman, we'll just invite the IATF. The possible topics, of course, is the vaccine procurement and distribution. Remember, in the vaccination law that we authored, Mr. Chairman, that you're also a principal co-author, in Republic Act 11525, we included the provisions, particularly Section 4 and Section 5, wherein we allowed local government units and the private entities to import vaccinations, as well as help government in the implementation of vaccines. So, Mr. Chairman, we just want to ask how the implementation of Section 3 and Section 4 and Section 5 of that law has been going on, and I believe this would be the proper forum, rather than requesting the committee on whole to conduct a hearing. Since you're going to have a hearing already next Tuesday or next Wednesday, isama na rin po natin sila, and then we can ask. There are complaints in TV. I watched last night. Governor Remulla was complaining about vaccine inequality. that Cavite was such a large province and yet he was not even being given enough vaccine. So we can all iron this out. Maybe the IATF also has a very good explanation, and hopefully we can invite them in the next
I
hearing.
think you will get some help from the IATF. I just want you to know the IATF provided the Red Cross with medicines, as they should, for vaccine. And we have 3 buses assigned to Cavite, 3 buses that will go bring the vaccine to the barangay, to the senior citizens, to everyone, so that we can facilitate. Other buses are going to Laguna and Quezon and
Yes.
Rizal, and we have already buses in Cebu. So the Red Cross is helping out as it should be, and we're very proud of that. So
Yes, and that is also an action of our law, Mr. Chairman. We put that under Section 5. We included the Red Cross as one of the implementers of the vaccination program.
definitely,
Yes.
and as we say,
You are my chairman.
as we say under Judge Jurado again, Justice Jurado, definitely. All right?
Definitely, Mr. Chairman. Bisaya po ko, Mr. Chairman.
Thank you. You can see I'm trying to retain my sense of humor because after I got COVID, I had a lot of thinking, and when I was alone there, I spent my birthday alone there. A virtual birthday party was given to me, and I was very proud of our people. But nonetheless, I really think that God is good, and we should all be happy and thankful, and we should all love on one another, even if we're not gay. All right?
You know, Mr. Chairman, the mere fact that we're all talking to each other today here in this meeting, we are blessed.
Yes.
We are blessed.
Well, you know, that's why I support all the gay folks. They're very, very gender neutral, and they're very good people, very creative, and that's why I always, as you know, we have a lot of them in the Red Cross, and I'm very proud of them as well. Thank you. So we will do that. Will the Director General please take note of all the issues that we're going to have to tackle? Dumami na ito.
Yes, Your Honor.
Remember, this is a Motu Proprio hearing. So we
Yes,
now
Your
have Senator Subiri, the concern of Senator Dillon and Senator Marcos, which are quite good on the matter of the procurement and other things. Kindly give us a heads up and kindly prepare. I would not want to see too many people because hindi naman natin matatawag lahat yan. Yun lang talagang sasagot. Andiyan na ba si Secretary Duque? Because
I'm back. Yes, thank you, Mr. Chairman. I'm back.
was it successful, Secretary Duque? At the very least, we can laugh about it, can't we? You know.
Yes, Mr. Chairman. Thank you very much.
So we will have another meeting on August 25th at 10 a.m. What is it looking like? Are we going to have an extension? Because right now, I just got the word that we have 11,000 today, and that our positivity rate is about 23%. I don't know whether we'll be ready to get back by Monday.
Possibly, Mr. Chairman, as your majority floor leader, we may have a skeletal force in the Senate. It is impossible for us not to have sessions next week because there are so many vending measures.
Likewise, I have to make a report. I have tons and tons of reports to make. And please don't use the word skeletal.
Our statutory rape bill, we have to pass it. Sa atin yan, sa ating dalawa. So we have to pass that.
Yes,
so,
I'll do that. And
we'll
also
go to work on the skeletal force, but we'll have work on Monday. I would request that for our colleagues.
All right, that's fine with me. You know, I'm a sucker for hard work, and we'll do that. All right, on that note, I thank you all very much. I thank our healthcare workers for your zeal. Do not lose that zeal. Never lose hope, because don't let your doubts stifle what you think rightfully and justifiably belongs to you. And I thank the Department of Health. Keep on working. Damn the torpedoes. You will know it never make everybody happy, but try to do as well as you can. Just like Attorney Giran in PhilHealth, he's trying to put good points into the goal so that at least may masasabing maganda. And certainly all the nurses are working so hard. And I thank my colleagues in the Senate. I thank the very genial, even if he's from the other school, but he went to the right law school, Chairman Aguinaldo of COA, and also all the others that have come here. Certainly, Thank you all very much, and congratulations to our new Secretary of DBM. The President will be wrong if he doesn't make you Secretary. I think you're a very, very fine lady. I like the way you answer. There's no hesitation. And I thank, of course, our staff, Rudy Kimbo, and the staff of the Blue Ribbon, and my staff for working so hard. And God loves all of us. So thank you all very much. Session is suspended until August the 25th at 10 o'clock a.m. Mabuhay ang Pilipinas. Bawal mamatay. Thank you very much.
Thank you very much, Senator Gordon.
Thank you.